Look lit. Mark, you can sit. Anyone can sit here. Mark, come on. Put you on camera. Come on, Mark. She's not gonna Okay, everyone, are we all ready? Yep. I'm looking around. Alicia's channel 8 ready? As far as I know, are we ready? The light's on air. It is. It's like we're ready, sir. Welcome. I'm going to take my mask off for this. Welcome, everyone, to the Tuesday, November 9th special meeting of the Boulder City Council. We will start tonight with one announcement that we have. It is the one that we typically have. COVID vaccinations are available, and you can find out more about how to get your vaccination or family members' vaccination at www.bouldercounty.org/families/disease/COVID-19/vaccines. And with that, Alicia, could you please call the roll?
Yes, sir, and good evening, everyone. Councilmember Brockett?
Present.
Friend?
Here.
Joseph?
Present.
Nagel?
Here.
Sweatlick?
Present.
Wallach? Present. Weaver?
Here.
Yates?
Happy to be here.
And Young?
Present.
Mayor, we have our quorum.
Thank you very much. The first item tonight is a motion to amend the agenda. We will add item 1A, which is a declaration in honor of high school students. And then we will change the order of the declarations for outgoing council members. We will add item 1F, COVID health briefing and response, and add item 1G, which is confidentiality issues around deaths. And then we will remove item 5A, which was the communication engagement update on council emails. So could I please have a motion to amend the agenda?
So move.
Second.
Awesome. We have a motion and a second, and we will do something new. All in favor, raise your hand. How do you do that? All right, and I see all hands. So we have amended the agenda 9-0. And then the next item is we need to go to Ryan, I believe, to speak to us about translation services tonight.
Thank you for joining us this evening. Let me go ahead and pull up some slides that will talk through interpretation.
Ryan, I'm not sure if you're muted or if it's your mask.
When I speak into the mic, can you hear me up there?
Better, yeah.
All right. So again, welcome. Thank you for being here. We do have interpretation available this evening. So please see in your Zoom menu an icon. It looks like a globe that says interpretation. You'll be able to select English or Spanish. And please make sure to select one language so you can hear anything that's said in either channel. And please make sure to click mute when not speaking to limit background noise. And as we have interpretation, a friendly reminder to make sure that you are speaking slowly, taking a breath between sentences, and clearly enunciating each word. And we'll try to stay in one of the language channels and make sure that we have some space between speakers. Thank you, and I'll turn it back to you, Mayor.
Okay, thank you for that, Ryan. And with that, I will make one more announcement. This meeting is being held in council chambers for the first time in a very long time, and it is a vaccine-verified event, which is why we're allowed to sit closer than 6 feet apart from each other, and we are allowed to take our masks off should we choose to do so. I will probably leave my mask off for the whole meeting so that I can direct it, but council members, it's your choice. Staff, it's your choice whether you want to leave your mask on or take it off as you speak. And with that, I believe that we are ready to move to our first declaration. Is that right? Very good. And with that, we have a declaration in honor of Diana Pinto Avina and Gia Salazar, and that declaration will be read tonight by Mayor Pro Tem Junie Joseph. Junie?
Thank you, Sam, and thank you for the opportunity to read this declaration. I am deeply honored to read it. A declaration in honor of Diana Pinto Avina and Gia Salazar, November 9th, 2021. On Thursday, October 14th, two brave Boulder High School students, Diana Pinto Avina and Gia Salazar, selflessly and courageously helped a Gasgrove neighbor in need. These two young women, both 9th graders, witnessed 73 years old Boulder resident Deborah Benko slip and fall backwards off the front steps of her home during a rainstorm. They ran to Deb's side and quickly called 911. They stayed with her and protected her from the rain with their jacket until additional help arrived. Sadly, Deb succumbed to her injuries, but thanks to the kindness of Diana and Gia, our neighbor wasn't alone in her final days, in her final minutes. The Gasgrove Neighborhood Association has formally recognized Diana and Gia by honoring them as individuals exemplifying the best of our community. When faced with an extremely difficult situation, they took it upon themselves to act, and they did so with maturity and compassion well beyond their years. We, the members of the Boulder City Council, recognize and appreciate the significant contribution made by Diana Pinto Avina and Gia Salazar. Thank you for your kindness that is a model for the entire community.
Thank you, Junie. And with that, I believe that we have some guests here tonight to accept the declaration and to speak to us. The first one I have on my list is Diana Pinto Avina and Diana's father. So Diana, if you are here, if you can unmute and turn your camera on, that would be great.
Hello.
We can hear you. Hi there, we can see you now.
Hello.
Great. We just read the declaration. If you have any words you'd like to share with the community, that would be great.
I was wondering, where's the interpretation?
We have someone interpreting for you. Would you rather speak in English or Spanish? Either one is fine.
Spanish.
Very good. So feel free to go ahead.
Okay.
Bueno,
¿Quieres decir algo?
would you like to say something?
¿Qué pasó?
about what happened to the lady? Well, you know what you did, and well, and yeah, you can. It's for your actions, for the lady, and what you were able to do. Thank you. Thank you for recognizing the help that my daughter provided with the lady.
Oh, we're happy to do so, and we really appreciate what your daughter did in that moment of stress. If that is any other from you, because we have another person we'll go to next.
Well, honestly, like I'm very generous of helping other people in need, even at their last moments, or if they're struggling with something mentally or physically. I'm always there for them mentally and physically to make sure that they're okay, because as a Boulder community, we stand together.
Very good. And with that, we will move to Michelle Bishop from the Goss Grove Neighborhood Association.
Sam, we actually have Mary Butler from Goss Grove. I apologize. We also have Gia Salazar here.
Let's start with Mary Butler, and then we'll go to Gia Salazar.
Hi, I'm Mary Butler. I am representing the Goss Grove Neighborhood Association, and I also happen to be a teacher at Boulder High, where Deanna and Gia are students. I didn't know them before this happened, but once the Neighborhood Association found out, we definitely we wanted to recognize them. And then, of course, I couldn't help but be a proud Panther, Boulder High. We had a short ceremony for them yesterday at Boulder High School, and the school district is going to recognize Deanna and Gia in January as part of the superintendent's circle. And we as a neighborhood association believe that they are just outstanding examples of good neighbors, good citizens, people who are looking out for other people. And Deb Danko lived in our neighborhood for a very long time. And from what I understand, she connected with the students because, as you know, Goss Grove is adjacent to Boulder High School, that she and her husband, Terry, were really friendly with Boulder High students and talk to them when, they park on the street and are kind of in our neighborhood, and people really respected Deb. And the fact that these young women were there for her in this time of need, it's just really appropriate and wonderful. So we obviously thank and honor these two young women, and we're so happy that the city of Boulder has joined us in doing this. So thank you.
Thank you for being here, Mary. Much appreciated. And with that, we will go to Gia Salazar. Gia, if you are on, you can unmute and turn on your camera.
Hi.
Hi, we can see you. So do you have anything that you'd like to say? We are certainly happy to honor the work that you did when you helped the person who had fallen. Do you want to tell us something about it?
Yeah, so when I first started walking, I was walking on my way back to school because we had lunch and lunch ended. So I was walking, and then all of a sudden I just I saw some feet, and I thought someone fell. So as we got closer, I was sure that it was feet. So then I told my friend Diana to call the police. And at first I wasn't sure what to do. I really didn't know what to do. Nothing came to mind except for call for help. So then that's what we did. And I don't know, I just at that moment I was a little scared because I didn't know if she was going to be okay or not. So, um, and then other people came by and they also helped us, and then that's when the ambulance came for her.
Very good. Well, thank you so much for what you and Diana did. It was very heroic, and we want to honor you for pushing through the fear that you felt. So thank you very much for that.
Yeah.
All right, thank you. With that, I think we are finished with that declaration, and we will move on.
Thank you, sir. Our the next item is item 1B, which will be our COVID health briefing and response.
Thank you. I know that we have almost now, oh, there's Camille and Lexi. We have our Boulder County public health partners who have helped us make this vaccine facility. And so we're able to be here with our mask off when we're speaking and encouraging folks to keep their mask on when we are not. And so I'll turn it over to Camille, Camille, Lexi, and the whole gang.
Thank you so much. Good evening, Mayor, City Manager Rivera Madrimid, and all of the council. We're always honored to join you and to share the data that we have relative to this pandemic with you and to answer questions as they come up. I have assembled an expert team tonight. With me is our new Chief Medical Officer, Dr. Michelle Haas. I didn't know, the last time that we met, I think I recall that Dr. Chris Urbina was on the screen and he has retired. But we are very lucky to have Dr. Michelle Haas with us. I also have one of our attorneys, Kate Haywood, here, and then our Deputy Director, Dr. Lexi Nolan. You know, we're coming right off of a Board of Health meeting last night. They received this update, and so will you. And what we are going to focus on, City Manager, Mayor, and Council members, is really a situational awareness and trends so that you can be abreast of what's occurring in our county and in your community. We're going to give you some policy developments that have occurred since the last time that we met. And really our Boulder County Public Health response from the epidemiology perspective, from vaccinations and vaccine equity. I really didn't introduce myself either, although you did, City Manager. I'm Camille Rodriguez for the public. I am the Executive Director of Boulder County Public Health. With that said, one last thing, I want the Boulder City Council to know how much we appreciate your city manager's collaboration with us and all of her staff's collaboration with my staff. I think it's fantastic partnership, and I just wanted to acknowledge that. So with that said, I'm going to turn this over to Dr. Lexi Nolan, and she will begin the situational awareness update on COVID-19.
Apologies, just a second. There we go. Good evening, Mayor Weaver, Boulder City Council members, and city staff. Thanks for having us this evening. We do have some important updates to share with you. Unfortunately, most of it is not going in the right direction, the direction that we would hope. Just to remind us all of our 3 goals to prevent severe illness and death. What we are seeing right now is transmission is increasing, but it's lower in Boulder County than in surrounding counties. We are seeing an unusual number of deaths over the past 6 weeks in Boulder County, but our death rate is still significantly lower than Colorado and the US. In relation to really trying to pay attention to not overwhelm the health system as a whole in Colorado, we are not doing a great job. But Boulder County is among the counties contributing the fewest patients to hospitals, and our vaccination rate amongst those 75 and older is over 99%, which is a very strong protective factor for hospitalizations. Our gap really in vaccinations is among youth who have the lowest risk of hospitalizations. Third, in terms of safely returning to normal activities, we are seeing that our school quarantines are significantly down this year, and our child case rates are lower than in most counties. So this is contributing to our successful ability to keep children in school this year. And our voluntary vaccination verification program offers safer options for patrons and supports businesses that serve more risk-averse groups. One of the reasons that we wanted to offer this program was really to pay attention that as we moved back to normal activities, there would be a group of folks in our community in Boulder County who would not feel comfortable going back to normal activities if they weren't around other vaccinated people. And we didn't want businesses to have to suffer because of that. And this is really an opportunity for businesses to cater to their own patrons' desires to be back in normal activities, but to do it in a safe way. And what's exciting about it is we're starting to see some interesting experiments in terms of businesses setting aside specific times for vaccinated folks to visit and to come and be part of the normal activities that they want to, and to do it with a certain amount of joy in their step. Our key messages tonight are that Colorado is in a surge and metro area cases are still rising. But as I mentioned, Boulder County is faring better than most others in Colorado. About 1 in 48 Coloradans are infectious right now. Hospitals and other providers are under significant strain due to the combination of COVID and non-COVID cases, including increased trauma and delayed urgent care from last year, which is now often has to be taken care of. And we are also seeing some significant staffing shortages. And these ripple effects of our healthcare providers also affect our ability to roll out vaccine and flu clinics and other things like that, because the staff are overwhelmed and exhausted and taxed. So just to recognize that, as we've said before, our health system is a system, and when one part of it's affected, it does tend to affect lots of other parts. So hospitalizations, which we'll talk about a little later, aren't separate from our ability to have a broader community response to containment. Our current projections suggest that, from the state, suggest that cases will peak in early December and hospitalizations in mid-December. We do have some additional concerns related to the flu, which is beginning to pick up, upcoming holidays, and resumed international travel. And at the same time, we have some optimism. Our shots for kids 5 to 11 years old began rolling out over the past week, and booster vaccinations have been in progress for a couple of months. And we are expecting vaccinations to continue to increase over the next couple of months as various employer requirements are implemented from local, state, and federal levels. Finally, Boulder County public health orders are expected to continue as they are currently written until at least January, due to the surge that we're seeing right now. So I will show you some generally familiar kinds of data and show you where we are in relation to epidemiological surveillance. This slide shows where Colorado is in relation to other states in the United States. You'll see that we are up here among some of the highest case rates in the country right now. Boulder County's own case rate would put us about here in the list. And this is where we were about a month ago. So our decline in the rankings, well, looks like an increase in the rankings, but in a bad way, is due both to the surge that we're experiencing, but also due to a lot of other states, particularly southern states, are seeing significant decreases in cases right now. So we've gotten a lot of questions about why are we having this surge right now? Why is Colorado going through this when we're not seeing it in other parts of the country, when our vaccination rate is relatively high, when we have, you know, better protections and more mitigation layers in place than a lot of other places? And this is being studied quite a bit by CDPHE, as well as some really smart folks at the School of Public Health and at different institutions. And it's not clear yet why we're seeing this surge. There is a sense that it's probably due to a combination of factors, some of which are listed here. What's not satisfying in that answer is that a lot of these factors don't necessarily set us apart from the states where we're seeing lower case rates. So there's also, you know, part of it could be there's potentially less testing going on in other states. Colorado is notorious for actually having really high testing rates among the population. It could be part of it. But we will continue to report back on what we're understanding is the driver of this surge as we learn more. This gives you some very specific information on where we are in terms of cases. This is our 7-day cumulative case rate. It's at 269 cases per 100,000. You can see it's quite a steep increase from the last couple of weeks. This graph gives you a sense that Boulder County is not alone in this struggle in Colorado, and in fact is surrounded by other states who are going through the same kinds of challenges. You'll notice that there are a few counties in around us that have those green declining indicators. It's worth noting that those declines are very small declines, just a few percent. And some of the increases are quite steep increases. This is a breakout by age rates. We are particularly concerned, obviously, about this 0 to 11 group, which is seeing a very significant spike over the last few weeks. The good news is that half of those kids are now vaccine eligible, and we hope that they will be moving towards a vaccination as quickly as possible. That will help all of us, because we know that when kids get sick, they often inadvertently spread in the household, and that it could be also supporting some of our other case rates, driving some of our other case rates in other age groups. Geographically, we are seeing that Boulder County has some differences, some disproportionate distributions. The city of Boulder, which represents about 32% of the population, only has about 24% of the cases, whereas Longmont, which is about 30% of the county population, has about 40% of the cases. And we think that this is likely due to a lot of permeability of the county border and the proximity to Weld County, which has significantly higher rates and no mask mandate. We've noticed that a number of the cities across the county that are close to the county borders, particularly for counties that have higher rates and fewer mitigation strategies in place, are seeing disproportionately high numbers of cases. In terms of case equity, we are seeing a fairly proportional distribution. Whites, who make up 77% of the population, have about 76% of the cases. A little bit of elevation in the Latinx population, which is 14% of the population, but about 19% of the cases. And our 7-day positivity has increased markedly over the last couple of weeks, particularly lately. We are seeing more people getting tested, which is good news. We want to see that right now. And we're seeing about 2,500 tests a day compared to 2,000 tests a day last week. Unfortunately, we are seeing some additional deaths lately. We have had 36 deaths since May of 2021, but we are still seeing significantly lower death rates compared to Colorado as a whole or to the US as a whole. So let's take a quick look at our health system because this is a critical pain point right now for us. You'll remember that our epidemiological team moves into surge response when we exceed about 50 cases a day. We're now at about 126 cases a day. What that means is that we prioritize who we spend the most time with and who we make personal outreach to based on vulnerability and potential for spread in the community. I will give a shout out to our team. Recently, Boulder County's surge response plan was highlighted by the state as a model practice and shared with other public health agencies. So we're very proud of the work that they've done to figure out how we make the most of our resources in very difficult circumstances. In terms of hospitalizations, we are seeing less than, at the state level, we're seeing there are less than 1,000 beds open across the state and less than 80 ICU beds as of today. We are expecting to see about 15,000 more COVID hospitalizations and about 2,000 more deaths in Colorado by the end of February. And in that north central region, which includes Adams, Arapahoe, Boulder, Broomfield, Clear Creek, Denver, Douglas, Elbert, Gilpin, and Jefferson counties, our ICU bed availability is at 7%. Our med surge bed availability is at 7%, and we have about 37% of our hospitals reporting significant staffing shortages. The state has now moved the North Central, or has moved to a combined hospital transfer center plan activated at level 3, which means that hospitals are proactively sharing patients to deliver the resources where to ensure that patients are situated where they can receive the care that they need and best spread and ration resources across the state. We have seen 19 pediatric confirmed cases of COVID that are currently in our 4 children's hospitals. We have 92 patients hospitalized for COVID-19 in Boulder County hospitals. Most of those are not from Boulder County. And this is just another graphic showing some of the resource declines. The purple graph is medical and surgical beds, and the blue graph is ICU beds. And you can see how critically close to the bottom we are getting there. In Boulder County, we only have 6 ICU beds available as of yesterday. This is just a graph that shows that as the hospitals and hospitalizations increase in Boulder County, they are similar to Colorado, increasing rates of hospitalizations. So this is creating an appropriate response from the state, and there have been a number of recent actions. The Colorado Hospital Association has become much more proactive about asking the public to please be careful and take precautions and use layered mitigation strategies. They are using social media, radio, and television ads to really reach out to the public and ask everyone to do their part to help keep health workers intact. We are also seeing state policy and executive order changes that Kate will talk more about in a few minutes. We're seeing mechanisms to expedite discharges from the hospital and transfers. And the state is investing a significant amount of resources right now to roll out monoclonal antibody treatments, which are projected to be able to reduce hospitalizations 13 to 23%. And we are also hoping that the 2 upcoming applications for emergency use authorization for 2 different pills that early data shows cut severe illness and hospitalizations will be approved. So let's turn for a minute to a little more hopeful spot and look at some vaccination rates. These are our updated vaccination rates, and it's very exciting to see this 5 to 11 added to the list. We already have 5% of the population with at least a partial course of vaccinations, and we'll be working hard to move that number up as quickly as people are ready for it. We have very good numbers in all of the other age groups, except we are continuing to do work on this 18 to 30-year-old population, which has lower vaccination rates than other groups. And we are looking at how we can continue to reach out to those folks and make sure that they understand what the opportunity is, what the risks are, and make sure that they have accurate information to make an informed decision. This is, just your usual update. We are now at 69.7% of the Boulder County residents have had a full course of the COVID vaccine. You will note that because we have now made ages 5 to 11 eligible for the vaccine, it's going to bring down our percentage of the eligible population in these 2 areas. That's not a bad thing. That's just getting a little bit further down the line and recognizing that we have a bigger population that now has the opportunity to get that vaccination. And just a quick report on boosters. We are now seeing that in our 60 to 69-year-old population, in our 70 plus population, which are the 2 most vulnerable groups that have seen declining efficacy of the vaccination over time, and they are the most vulnerable to severe illness and death. We have seen that in that 60 to 69% age, 60 to 69 year old group, that about 86% were fully vaccinated, and of that 86%, 36.6 have now gotten a booster, and among 70 and older, about 98% were vaccinated and about 55% have gotten a booster. So that's terrific news. It means that people are seeking the boosters out, and they are being able to move in that space to get them. We need to continue to do that work to make sure that they're safe as we move into the next few weeks. In terms of vaccination support, just to let you know what we are doing at Boulder County Public Health. And I do want to give a real shout out to the City of Boulder and our partners at the City of Boulder who are working hard to make sure that you are also playing a great role in offering vaccinations to folks. And we really appreciate your partnership in that space. Among the 5 to 11-year-old vaccinations, our goal is to not as just the agency, but as a county, is to vaccinate about 14,000 of the 23,000 kids in that age range. So about 60% by the end of January. That we think that's actually a realistic timeframe for getting that work done. We do have 67 enrolled providers that are working with us in this space. They are listed on the BCPH website. We as an agency are offering clinics at the Longmont Hub on Fridays and Saturdays for November, December, and January. We are working with our community ambassadors to make sure that priority populations are able to access those equity clinics. We're also giving parents boosters if they show up and want one, because we want there to be kind of a no wrong door of getting shots in arms. And in the long term, the plan is to integrate those clinics into BCPH's children's clinics and the other equity clinics. BVSD is also offering some equity clinics at 3 elementary schools and at Teens Inc. in Netherlands, and we are working with SBVSD to explore a clinic at Timberline. We continue to offer equity clinics for 12 and older at Longmont Hub on Thursdays, and we are engaged in 2 vaccination education campaigns. One is focused on vaccine hesitant parents under 12, and the other is focused on youth and young adults. And one thing that's interesting that we're finding is that the prevalence of mental health challenges in that age group is one of the barriers to those kids, those young folks getting vaccinated. And so we're looking at how we can create strategies that address both of those issues together. And I am happy to turn it over to Kate Haywood.
Awesome. Thank you all for having me here. I am going to briefly discuss some local, state, and federal legal and policy context issues. There's been a lot of movement in this area over the last month. As a reminder, Boulder County Public Health School Mask Order has been in effect since August 9th. This is in effect until rescinded. On September 2nd, Public Health issued a universal mask order. And as a reminder, that will no longer require masks on its own terms once we move into moderate or low transmission for a 21-day period on CDC's tracker. On October 29th, Public Health issued a public health advisory because based on the data Lexi shared, we are in surge conditions, specifically with respect to hospital capacity locally and around the state. That public health advisory made 2 recommendations, which both follow CDC recommendations. One is a recommendation to move indoor gatherings outdoors. And the second is a recommendation that if you are in a crowd of people from different households, even outdoors, that you should wear a mask. This is not intended to be new or novel. Again, this is following CDC recommendations, but rather meant to be an advisory so the public is aware of what's going on. Next slide, please. Okay. Public Health's business team is continuing to work with businesses, both with respect to education and enforcement of orders, as well as responding to the vaccine verification program. To date, we have had 288 businesses apply to the vaccine verification program, of which 241 businesses have been approved. And the remaining businesses are in various stages of that process. On Public Health's website, there is a publicly available list of all facilities with descriptions of what they are, and they sort of range across various industries. Our neighbors and local municipalities have also been taking action. Denver has a vaccine requirement via a public health order for workers in certain sectors. Local governments here in Boulder County, City of Boulder, Longmont, Boulder County, and others have all made vaccines mandatory for their employees. And we continue to have school mask requirements around the state. These have been put in place both by local public health agencies, as well as many school districts are stepping up to do this work. Okay, with respect to what is happening at the state level, about 2 weeks ago, the governor outlined his plan for addressing this surge and the number of cases appearing in our hospitals. The governor's goal is to maintain hospital capacity levels so that those who need care can get it. Looking at the items that the governor outlined, there's approximately 5 to 6 of them. Almost all of them have been put completely in place. FEMA medical surge teams have been requested from FEMA. The governor implemented CDPHE Order 2021-02, which delays cosmetic surgeries. The governor has not yet delayed elective surgeries, but has indicated that that could be coming. There is also now a legal framework in place for hospitals to request to go to crisis standards of care, and that was issued via Executive Order 2021-136. What this does is it puts in place when hospitals cannot manage the number of patients they have and they need to triage at a higher level to determine, for example, who will receive a ventilator and who won't. While this is, definitely a scary situation, it provides that legal framework when it's needed. The governor also put into place a patient admission and transfer order, which serves to balance our hospital capacity around the state. Without this order, there can be barriers to transferring patients due to, for example, insurance requirements. And so what this does is it eliminates those barriers so we can ensure that we're using all of our resources on a statewide level. This order also allows hospitals to deny admission to certain people and to send them to other facilities if necessary due to the capacity of their facilities. The state has also issued a HAN, a health alert network message, to healthcare providers saying how monoclonal antibodies should be distributed, and the state is ramping up efforts on that, as Lexi mentioned. The state has also followed Boulder County Public Health's lead and has issued a public health advisory regarding limited hospital capacity in the state. In addition to these actions already taken, we can expect to see more from the state along these lines. As I previously mentioned, there is potential for elective surgeries to be delayed, although the governor has not issued the specific order yet. There's been a lot of movement on the federal level as well. OSHA issued the rule for the president's directive that employers with 100 or more employees be required to vaccinate by January 4th, and unvaccinated employees must mask and test once per week. This affects 84 million workers. There was an immediate legal challenge to this requirement. That's why there is an asterisk there next to employees. The Fifth Circuit has temporarily stayed this order to determine whether OSHA is in fact the right entity to issue this order, a jurisdictional issue. We are closely following that. It's expected that there will be legal challenges to any of these actions, and we'll see how those play out. I will say that many large companies have already implemented vaccine mandates in anticipation of this OSHA rule. Separate from the OSHA rule is that the federal workforce, including the military, now has a vaccination requirement, and they must be vaccinated by November 22nd. There is no test out option for this requirement, and it only permits the legally required exemptions, which are religious and medical exemptions under Title VII. There is also a requirement for vaccination among federal contractors. Federal contractors include companies such as airlines who work with the federal government. And this ends up covering another large group of people, although I don't have that precise number. In addition, there's going to be 17 million workers covered by the Medicare and Medicaid requirement for healthcare facilities. These people must be vaccinated by January 4th. And again, there is no test out option. Next slide, please. More information about what's going on in the courts. Jefferson County Public Health issued a mask mandate for schools, which was challenged on religious grounds. The district court in Jefferson County upheld Jeffco's mask mandate against those religious challenges, and the mask mandate for schools as issued by Jefferson County still stands. It's also possible you've heard about the Douglas County School District mask mandate. In short, the Douglas County Public Health Department issued a public health order allowing for a personal exemption to the school district's mask mandate. The federal district court in Denver granted a preliminary injunction ordering that Douglas County should not permit a personal exemption to mask mandates in schools, as those personal exemptions can violate the rights of students with disabilities. One side effect of this order is it has alerted a lot of other school districts to the importance of not only having a mask requirement, but also enforcing requirements in a manner that's going to most protect our vulnerable populations. We've also seen a number of challenges to various vaccine mandates by employers, universities, and governments. Again, this is not unexpected, but they've pretty much played out the same across the board. Religious challenges on constitutional grounds have been largely unsuccessful. You see the religious exemption in the employment context because of Title VII, which is a federal statute. It requires certain employers to have a religious exemption for vaccine requirements. But the courts have largely said that there is no constitutional right to a religious exemption for a vaccine mandate. We've also seen the US Supreme Court upholding vaccine mandates in various contexts. The employer context, with respect to the New York City teacher vaccine mandate case, the university context, and also the public health order context. And that is, there was a case out of Maine where the state issued a healthcare worker mandate. The one caveat to this is the Fifth Circuit, as I mentioned, looking at that OSHA jurisdictional issue. And the issue being whether OSHA can issue this rule or whether it would need to come from another body such as Congress. Again, we are also seeing many employers requiring vaccines on their own. We're not seeing the type of exodus of employees due to vaccine mandates that was originally feared. It appears that the requirements are largely working. Some states have already declared that getting fired for failure to vaccinate does not entitle a person to unemployment benefits. And we are also starting to see that some industries, such as teaching and healthcare, it may actually become very difficult for an individual to get a new job in these industries without being vaccinated due to the complex network of vaccine requirements. Thank you.
So this concludes our visual presentation. We do want to turn the microphone over to Dr. Haas for a few minutes. And we're so glad to have you with us, Dr. Haas. Welcome.
Well, thanks for inviting me. I thought I'd say a little bit more about myself and some of the I think the glimmers of hope. So I'm an infectious diseases physician, and I've worked in TB and HIV care for past 12 years. And so I just recently joined Boulder County Public Health in October to take over for Dr. Urbina. I am hopeful, and I think we've had a great start to the rollout of vaccinating kids aged 5 to 11. The vaccines are highly effective for this age group in terms of preventing infection. So 90% effective, really minimal side effects. And, at least my own sort of limited personal experience, at least with having my own elementary school age kids, is that they've tolerated it really well. And so have their friends, because they're all talking about it. So I do think that that this is an exciting development. I think it remains to be seen how much this will impact community transmission. It certainly will impact, keeping kids in school and keeping kids safe. And I am hopeful that we may see some reduced transmission in families as well. But I think that remains to be seen. And I don't know if there's I'm also happy to take questions, or, I don't know if that's the right space for this, and hear any concerns. Thank you.
Great. I'll jump in and say thank you to you, Camille, Lexi, Michelle, and Kate for being here. We, as always, appreciate getting the update, and it sounds like this is pretty fresh information for us. So, and as you say, a bit discouraging, but we will focus on the upside of people getting more vaccines. So with that, I'll turn to council and see if there's any questions. I have Bob.
This is probably a question. Thank you very much for the presentation. This is probably a question for either Dr. Haas or Dr. Nolan. If I go to the Boulder Community Health website and look about booster shots, it seems to me it indicates that for those who are under 65 and who don't have certain health conditions, boosters are not yet available. Am I reading that right? And if so, when will boosters be available for healthy people under the age of 65?
I can take that.
However you want.
Yeah, so it's a really great question and observation. So you may also notice if you go to CDPHE's website that they're, and the state has said that because Colorado is a high transmission environment, that we're all at high risk. And so anyone aged 18 years of age and older who lives in Colorado, who's 6 months out from their first series, is now eligible for a booster shot, which is it's like, it's a little bit different than what CDC is recommending. I did hear that CDPHE did actually have a conversation, did communicate that with CDC, and CDC isn't concerned about Colorado taking that stance. So what that would mean for all of us who are, don't have those underlying medical conditions, if you're 6 months out, is that you're eligible for a booster if you live in Colorado.
Okay, that's great. That's good news. It's a little different than what BCH is showing on their website, so maybe that needs to be updated. So if for those who are watching who are under 65, who don't have a health condition, how do they get a booster shot? What's the best way? I know Sam read off a booster link at the very beginning of the meeting. Is that as simple as that? Is just going to your pharmacy or going to your doctor and getting a booster regardless of your age if you're 6 months out?
Yes, in theory. I mean, I think in practice sometimes it's a little hard to navigate, but yes, you can go to a pharmacy and you can go see, talk to your provider and get a booster that way. So, and I will name that. I mean, that this stuff is really rapidly changing. It's sort of it's sort of the era that we live in, and so we'll get the website updated as soon as possible.
Just to mention also that when you sign up to make an appointment, that you do a self-attestation process. You say what your rationale is, and you're taken at your word for why you feel you need a booster. And people are just encouraged that if they feel like they're ready for a booster, if they feel like that would provide extra protection for them and their families, to go ahead and take that step.
Great. Thank you guys for the answer. Junie, I see that your hand is up. Do you have a question?
Thank you, Sam. I have 3 questions I wanted to ask based on the presentation. And thank you, Bob, for asking that question, actually. And I just want to ask that question first before we move on. For someone who's healthy, someone who's young, what is the purpose of getting the booster shot?
I can take that one. So what we're seeing both in the US and then also there was some early data coming from Israel is that it looks like immunity or protection against COVID-19 starts to go down or wane right around 5 or 6 months. And so, it's hard to actually, to be honest, factor in the impact of Delta and waning immunity, but that effect has been pretty consistent. And also it's not only seen with Pfizer, but it's also seen with Moderna as well. And so because we're seeing this is why, CDC went ahead and took that recommendation. There does seem to be, I mean, the data that we have, looks back all the way down to ages 16 years of age and older in terms of seeing this waning immunity. The best data I've seen so far, both coming out of Israel and then also from the US.
Thank you. My next question is, you talked about on slide 8, you talked about the numbers per 100,000, and I saw 243.72. And then on slide 23, you talked about the 18 to 19 group, which is only a 41% vaccination rate. And I wanted to know, for Boulder County, similar to the map that you have on slide 8, do you have like a heat map to know which part of the community that is leading to this surge?
Right, so the slide that we presented on the geographic distribution points, what was obvious in the slide was that Longmont has a disproportionate number of cases, and then there was kind of this other municipalities and unincorporated Boulder. When you begin to break that out and you track it by more specific municipalities, Erie, Lyons, Nederland, it is the counties that are closer to our borders of other counties where we, where we have a lot more permeability of the county line, and people going back and forth, people commuting for work and school and play, going in and out of Boulder County, and mostly into counties that have much higher case rates than we do, and it just creates a bleed effect.
Wow, no, that's interesting to hear. I wouldn't have imagined that the surrounding counties are impacting us that tremendously, especially knowing that Boulder County itself has a university right here, and it's and we have a university here in Boulder with a lot of young people between 18 and 19. So,
but our university students are over 95% vaccinated.
Wow. Thank you. That's great to hear. That's very encouraging. I think my last question for you is, earlier you talked about gathering. I just need some clarification around gathering. You said even if people are gathering outside and they're fully vaccinated, they should still wear a mask. Did I get that correctly?
If people are gathering closely together, if they're in crowds, if they're going to concerts, if they're in close proximity to a lot of other people, yeah, it's a good idea to wear a mask right now, even if you're outdoors, but particularly if you're in larger crowds.
Thank you so much for that explanation. Thank you. Thank you, Sam.
Thank you, Junie and Rachel.
Thanks. Can you hear me? It's been a while since I used this. Yeah, okay. Yeah, thank you for the presentation. I have just a couple questions. You said that businesses can get certified and then they don't need people to present vaccines. How does that work with businesses like restaurants or retail? Are those businesses able to get some hours certified, or is there any eligibility for kind of safe shopping at this point with vaccines?
Absolutely. The program, I'm sorry, Kate, why don't you take that one?
Yeah, I was just going to say that the vaccine verification program is intended to be very flexible. We want to encourage businesses to apply, and we want to find a way to make the program work for all businesses. I will say that the majority of businesses that have applied have primarily been offices that do not generally face the public, so it's easier for those businesses to apply. With respect to retail and restaurants, we are encouraging those businesses to look at having they can have designated hours. You can have designated classes in a fitness center, for example, where only areas or certain times are vaccine verified, whereas the rest of the time masks would be required. We have not seen a large uptake in the program amongst restaurants. We are hoping that will increase now that 5 to 11 are vaccine eligible. And we're also, working closely with the chamber to try and promote the program amongst industries that are not heavily represented right now.
So in theory, like a restaurant could say Tuesday nights are going to be only vaccine eligible. And do we give them an easy way to present your vaccine status? Are we rolling that out as a county on an app or something?
Yeah, we would love we would love it if restaurants would consider having vaccine verified nights. And with respect to showing proof, that also is intended to be very flexible. So I would say the most common forms of proof are, people have their physical cards, their CDC cards. They can show a picture of their CDC cards. And then the My Colorado app has been a really useful tool for showing proof. It's just an app and you can pull it up on your phone. You can also pull your driver's license up on that if you need it. So really, or you can even, present healthcare records from your provider. But across all of those boards, we're hoping, that captures everyone that wants to participate.
Awesome. I would love to see those kind of nights too. So if there's something that we can do to help, please let us, or at least me, know. Okay, next question. I think I heard you say that the state goal was to keep hospitals under capacity, and it sounds like we're close to that not happening, that we are down to a low number of beds. So is there any chance that the state's going to do some more aggressive statewide actions? Like, I think this time last year, I could only get together with like 2 other people in a backyard, right? We're 6 feet apart. We were all sort of hanging outside with our close friends in small groups, and we had mask mandates. So is the state looking at any of that? And are we as a county going to look at any more of the physical separation ideas like we had implemented around this time last year? I don't know who that's to.
Yeah. Neil, do you want to take that one?
And I guess a follow-up, is there anything
Yeah,
we can do as a council if we wanted to, advocate in that it feels like Boulder County is doing what we can do, but it is still seeping in from nearby counties who don't have the mandates?
I can give this a try. Thank you for those very spot-on questions. We are in constant conversation with colleagues from our surrounding counties, and often with CDPHE, our state health partners. And we all row in the same direction to have our leadership at CDPHE encourage the governor to take extra actions that would protect and promote the health of all of the citizens of Colorado. We've been very supported by the Boulder County Board of Health in the recommendations that allowed us to implement the 2 public health orders that Ms. Haywood explained to you. We utilized the public health advisory most recently right before Halloween, because we know that this community enjoys gathering for fall celebrations, and knew that we needed to remind the community to continue to row in the right direction of the layered mitigation strategies that we have in place. We obviously, as a local public health department, cannot predict what the governor will do. It was encouraging that the slides that Ms. Haywood showed you of the executive orders relative to trying to mitigate the issues relative to hospital and ICU bed capacity. We would have always hoped that we didn't have to put in place the public health orders that we did. We don't mind taking the leap to protect our most vulnerable, which is why we started with the school public health order and then followed with the universal indoor public order. But always we would have hoped that the governor would have seen that this was an action oriented to changing the behaviors, to implementing layered mitigation strategies to prevent community spread and to prevent the hospitals feeling what they're feeling now. I know the governor pays attention to Boulder, and I know that we have some continued opportunities to present why we feel like our strategies have worked, and those are going to happen in the future. I can't give you advice as to whether or not you should advocate for more orders or for more layered mitigation, but what I will say is that was our intention in the first place, that if everyone rode in the direction of wearing their masks and even taking our advice outside of the order of wearing face coverings when they gather in large crowds outdoors, that we would prevent our community from having to go back into something more extreme like a lockdown or limitations on gathering size. So at this point, we continue to always want to serve and support our community and to work with CDPHE to continue to advocate so that regionally even we could be rowing in the same direction with orders, but that isn't what played out. And I think that you all saw that in the data that Dr. Nolan presented and how we explained to Council Member Joseph that we have a situation where those areas of our county that are closest to places without orders are experiencing the highest caseloads. So to that end, really, I'm going to close out this answer with our gratitude to you and to your city manager and staff for helping us achieve the implementation of especially the universal masking order, and for supporting us, especially with the vaccine verification program, because without that kind of support, I think we would be having an entirely different discussion about case numbers and hospitalizations in Boulder County. And so thank you for your discernment there to know that part of this is at the highest levels of leadership, but we're willing to lead and have done so, and we appreciate your support in that.
And I appreciate your leadership as well in instituting the county mask mandate that we have. Two more, hopefully shorter questions. One, did I hear you say correctly, or did I correctly hear that the hospitalizations that we have in Boulder County are mostly non-Boulder County residents?
Yes.
Okay, and what percentage is that?
I would have to get back to you on that. I'm not even sure I can get that information, but I can see if it's available.
A follow-up email would be great. And then last question, I think that 16 and 17-year-olds were eligible for shots before 12 to 15 or 11 to 15-year-olds, and I don't believe that they are eligible for boosters yet. Just wondered if you know why that is. I think there are a lot in that age group that are frontline workers and working in healthcare facilities and have the waning immunity. So confused, is there a health risk for them to get boosted, or do we see that happening soon?
I'm sorry, can you state your question?
16 and 17-year-olds are not eligible for boosters yet, but they are outside the 6-month window. Do we know why they're not eligible? Or
because it's 18 plus.
Right. I'm just wondering, do we expect that might change soon, given that they are equally at risk as a 19-year-old?
Dr. Haas?
Yeah, I can take that one. It's possible that will change. I was actually just looking this up yesterday. So in the Lancet, they just published the experience with Israel. So Israel has actually offered boosters down to age 12. And in their most recent publication, they looked at 16 and older. And then when they looked at outcomes, they actually lumped in 16-year-olds with the 39-year-olds. And so it's just really difficult to sort of tease out, risk benefit in the younger age groups based on the data that's presented so far. But at least that tells me that Israel does have data on impact of booster dosing in the younger age groups. And so hopefully we can learn from their experience. And I think one of the key questions is just ensuring safety with the boosters in that younger age group. And I think the data are there and that it is safe. It's just that hasn't been presented yet. And so that's one of the reasons why I think that, that the recommendation so far has down to 18 and older. I also saw a headline that Pfizer was going to ask the FDA for EUA approval to give boosters to all eligible folks that can be vaccinated. I don't know where that's going to stand. I mean, so it sounds like, I think all of that tells us that there is data that can be looked at, that it's going to be, that Pfizer, that the FDA may be looking at this soon. And so hopefully we'll have more information on extending to those lower age groups by the end of the year. But so it's an excellent question. And the bottom line is that we, I think there's data, but it's just not readily available such that we can make decisions on extending boosters down to that age group. But I also think, just like with all things COVID, things are evolving. This may be something that will change.
All right, thank you. That's all my questions.
Not a question, but just a shout out to the 30 to 39-year-old group for being second highest in vaccination rate. Way to go for the no good millennials for helping lead the way.
Wow, at least there is an upside. I have one question, which is, it looks to me from the chart that you showed earlier like we've had a little more than 20 deaths in Boulder County in the last month or so. Do you know what fraction of those were unvaccinated?
I don't offhand. We're hoping that we can find some bandwidth in the next couple of weeks to do a little bit of a dive on what's going on, why we're seeing such an increase in deaths, and to see if that gives us any strategic direction for how we can intervene a little bit sooner in some of those spaces. And that will be part of the assessment and the analysis, is to take a look at that distribution.
Great. It just seems like if we can emphasize that point over and over, the protectiveness of the vaccines, that's just helpful for everyone to hear. Mark has a question.
Well, first, thank you for that complete and very sobering report. I actually only have one question. As we are getting down to the sort of the bottom of the barrel with respect to our ICU beds, is there any possibility of creating more ICU beds?
Do you know the answer to that question, Michelle?
I'm sorry, you're on mute, Michelle.
I'm sorry. It always has to happen to me at least once a day. I don't know the answer to that. All I can say is that in general, and I'm really just speaking from my own home institution at Denver Health, like we have talked about ways to, redeploy hospitalists, for example, that have ICU experience, and sort of shift how staff, are utilized in that capacity. I really can't speak for, how local hospitals might be handling that. So I think we'll probably have to get back to you and really probably talk to some of the local hospitals to see what their plans are.
Thank you. I'd appreciate that.
I know that the state is also working on bringing more ventilators into Colorado from states that don't need them as much as we do right now. And we are importing a very significant workforce, both through FEMA and also through other arrangements of providers in states that don't need them as much as we do, that I think is going to make a significant difference in the staffing issue that we're facing right now, and will support the rollout of the monoclonal antibody treatment, which is expected to be a significant contributor to preventing the need for more ICU beds, so that we can prevent that level of severe illness a little bit more aggressively.
Thank you.
All right, great. Council, any more questions? All right, seeing none, I will thank you again for being here. Hopefully next time it will be all good news and we really appreciate the work you're doing and the partnership we have with you. Thanks so much.
Thank you, Mayor. Thank you for all of your time tonight. Much appreciated.
Thank you very much. And with that, we will move on shortly, but Junie Joseph, I believe, has a few words she wants to say. I think you have to leave, and so I'll kick it over to you, Junie.
Thank you, Sam. And I know this is the last council meeting with the old council, and there will be a new council. I just wanted to take this moment to just share my appreciation and thank all of you. I'm one of those people that I do not like goodbyes, but hopefully this is not goodbye, but see you next time. I met you 2 years ago when I became a council member. And over the last 2 years, we've endured a lot together as a council and council members. We've dealt with a once-in-a-lifetime pandemic. We've also dealt with a tragic shooting in our community, but we also had good experiences. We've worked on the budget, homelessness, and policing, and we've also worked on racial equity and various other issues. The work is not done or over, but I understand that life takes all of us in different directions at times. And now, before leaving the council, I hope you will reach out about the issues that are important to you. I look forward to seeing you around Boulder, whether on open space or on the Pearl Street Mall. God bless and Godspeed. Thank you, Sam.
Thank you so much, Junie. Much appreciated, and have a good rest of your evening.
Can I add one thing?
Thank you.
And also a very happy birthday to Junie Joseph as well.
Happy birthday. Okay, with that, Alicia, I think we're ready to move to declarations. Is that right?
Mike, it's like my mute button. Yes, sir, that is correct. Next on our tonight's agenda, we have the declaration in honor of Adam Swetlick's service on the Boulder City Council, and that'll be presented by Councilmember Friend.
Do we go up? Okay.
Do you have a mic?
Thank you. Can everyone hear me? Oh, good. We're going to look at each other. I want to apologize because look at Adam Swetlick is dressed up so nicely here for his last day, and I didn't realize we'd be visible from the waist up. So apologies for the, it's been a long Zoom. Okay, Zoom habits. Okay, I'm reading a declaration honoring Adam Swetlick's service on the Boulder City Council, dated November 9th, 2021. In 2019, Adam Swetlick was elected to a 2-year term on the Boulder City Council. Originally from Green Bay, Wisconsin, Adam moved to Boulder in 2006 to attend the Leeds School of Business at the University of Colorado, CU at Boulder, graduating in 2010 with a bachelor's degree in marketing. Since graduating from CU, Adam has worked in eclectic jobs, ranging from head coach of the University of Colorado club rowing team, to door person for the Walrus Saloon, to currently a marketing specialist for a local honey company called Bjorn's Colorado Honey. Adam has been a strong advocate for reducing wealth inequality and for increasing affordable housing, living wages, transportation options, and funding. In 2017, he was appointed to the city's Housing Advisory Board, serving as board chair before being elected to council. While on council, Adam has served on internal city groups such as the Audit Committee, Council Retreat Committee, Guiding Coalition for Racial Equity, and the Sister City Subcommittee with me. He has also represented the city on regional groups and partner organizations, including the Resource Conservation Advisory Board, the Boulder County Consortium of Cities, and as an alternate to State Highway 119 Coalition, State Highway 7 Coalition, and the Boulder Convention and Visitors Bureau Board. Moreover, and I would say most importantly, Adam has steadfastly served our community with unparalleled integrity and heart. and I'm going to try not to cry now, on issues ranging from homelessness and affordable housing to municipalization and climate crisis resiliency. Adam has been fearless in giving insight from his generational perspective and making space for other underrepresented community voices to be heard. We, the City Council of the City of Boulder, Colorado, recognize, honor, and appreciate Adam Swetlick's service on council and his many contributions to the community. And I will just say on a personal note, I am deeply saddened that he didn't run again and will not be here for my next 2 years. So, thank you, Adam. Does he get to give a speech? Yeah. We should, yeah.
Do you mind holding this? Nope. Thank you. Well, thank you, Rachel, for reading that. One of the things that I've cherished most is we all came in from very different backgrounds and with very different viewpoints. And over the time that we've been here together, we've really been able to just coalesce as a group together and tackle the tough issues. And, you know, during all that time, even though we didn't get to be together physically, I just think so highly of all of you, city staff, city council, the community members in the city. It's just been such a hard 2 years, but we've come out the other end. And as you heard, we're not quite there yet, so please be diligent as much as you can. But it's been such a cool experience, and I wouldn't trade it for anything. Probably my biggest accomplishment is making sure meetings start on time. And I expect that to continue for those of you who are going to be here, because if it doesn't, after a year, I'm going to come yell at you about that. So please, you know, keep that up. City staff, Nuria, please do your job and keep them on task. I have no doubt that you will. There's so much I could say, but honestly, going forward, I just really hope that all the members of our community really try to lead with kindness. I think through the pandemic, we've seen a lack of that, and it means so much, especially to the sitting members of council. When you get a kind email, when you get a kind word from someone, it means everything in the world, because that's very rarely what we get. So it honestly sustains us through. And I know the ones who are continuing over the next 2 years, they're going to need that help based on what they've been through. So just thank you all. And I'll leave you with, you know, a few words my grandma taught me. She was 4'10", but she was towering above me in terms of love and kindness. And she always said, you know, you don't always have to agree with everyone, but you have to try to be nice to them. So I just wish that for our community, and keep trying to do that. Please tip your servers. They need it more than ever. And yeah, thank you all for the awesome ride.
Thank you, Adam.
Before I pass this on, while we watch Adam go back to his seat, I just wanted to make sure the community could all see that he's got his rainbow light there. I don't know if anybody noticed. And should I pass this?
Alicia, could you take us to the next one, please?
Yes, sir, of course. Next, we have the declaration in honor of Mirabai Nagel's service on the Boulder City Council, and that'll be read by Councilmember Wallach.
Thank you. This is a declaration honoring Mirabai Nagel's service on the Boulder City Council and dated November 9, 2021. In 2017, Mirabai Nagel was elected to a 4-year term on the Boulder City Council. Born and raised in Boulder, Mirabai now lives in Gun Barrel, a northeast neighborhood of the city. She has a deep love for her hometown and feels a deep commitment to making it a better place. Mirabai attended the University of Colorado at Boulder, where she graduated from the Leeds School of Business with a Bachelor of Science in Business Administration. Later, she also attended the Gemological Institute of America, where she received her graduate gemology degree while also working in a fine jewelry store. After moving back to Boulder in 2011, Mirabai joined her family business as a jeweler. An avid animal lover, Mirabai has worked to protect Boulder's rich and unique open space resources and all the diverse plant and animal species that call it home. In 2011, Mirabai joined the Sugarloaf Fire Protection District, or SLFPD, and in 2014 she became a certified emergency first responder with SLFPD and won Firefighter of the Year. During her time on council, Mirabai has served on internal city groups such as the Boards and Commissions Committee and the Charter and Elections Committee. She has also represented the city on regional groups and partner organizations such as the Rocky Mountain Greenways Steering Committee, Commuting Solutions, and as an alternate for the Rocky Flats Stewardship Council. Before I conclude, on a personal note, I want to say that I've always respected and admired the passion and commitment that you brought to all of the things that you hold most dear. And I thank you and honor you for that. Accordingly, we, the City Council of the City of Boulder, Colorado, recognize, honor, and appreciate the service on council and the significant contributions made to the city and community by Mirabai Nagel. Thank you.
Mirabai, any words?
Yeah, thank you, Mark, for reading that. Really appreciate it. If you guys can't hear me, just let me know. I'm sorry I couldn't be with you in person tonight. I have some sick kitties at home that needed my care. So I just want to start off with, first of all, thanking my family, my parents, and my husband for the support through this ride on council. As Adam said, it's been wild. I want to thank my campaign manager, who has spoken to me many times and walked me through some difficult situations, and just the support she provided me throughout the 4 years, along with many other friends and staff. I want to thank the staff members I was able to work with over the 4 years, new ones and ones that have since left, especially Heidi and Lynette. They were joys to work with and get to see when we were there in person. And so I just really appreciate the service from everyone in our community. I guess the one thing I will say moving forward that I will request of the next council is to remember that this community, I think, is made special because we've always taken a notice of the world around us and how dearly special that is to everyone. And that's why so many people move here, and that's why we have our open space. Remembering that when we make votes, that we not only affect ourselves, but we affect our surroundings and the interconnected web of the world that exists. And so by remembering that maybe humans don't always take the forefront, and that sometimes we remember that nature and wildlife also need to be present in our goals, and to look at generations forward and how things are going to be affected in that manner with the votes that we make, is desperately important moving forward in the world that we now live in. So I just request that you try to remember that from time to time when you are up there with the huge responsibility of voting for this town, for the town that some of us have grown up and seen change so drastically. Because for me, it's sadly not been the best change. I've seen a lot of sad things in my years that I've been here. And so I really hope that that can turn around. And as Adam said as well, I hope that we can start showing each other the kindness. This was a difficult 4 years, probably the most challenging of my life. And that's where my family support came in. And even my animals, being able to come home and cuddle a cat made my day. And so those wonderful words of support from the community members that we do rarely receive really can make a difference. And so you might disagree with someone, and that's perfectly fine. And that's what's so wonderful about being in America, is that we have the right to disagree. We have the right to vote against something that someone else absolutely advocates for. But in the end, to remember that there's a level of respect that would be nice to be shown to everyone, and that we all have value, and trying to remember that sometimes can be difficult, but it exists. So I wish you all the best of luck moving forward. It's been an honor getting to serve with you all. And I'm so sorry I could not see you in person tonight.
All right, thanks very much. And Alicia.
All right, sir. Next, we'll have the declaration in honor of Mary Young's service on the Boulder City Council, and that'll be read by Councilmember Brockett.
Okay. All right. Well, let me just start by saying this is a great honor to be able to read this. A little further down. Where? Right, like, up. It's a great honor to move to the center of the room and present this declaration to Mary Young. Mary and I have worked together for 11 years. When I first got on planning board 11 years ago, Mary had a couple of years of tenure. I looked up to her and I learned a lot from her. And then she went on to council. Yes, exactly, I looked up. And she moved on to council, and a couple years later, I followed on to council and again looked up to her and learned a great deal from her and have continued to learn from her up to this day. So, as I say, it's an honor. Here we go. Declaration honoring Mary Young's service on the Boulder City Council, November 9th, 2021. In 2013, Mary Young was elected to a 4-year term on the Boulder City Council and was re-elected in 2017 to another 4-year term. Throughout her 8 years on council, Mary has used her voice to amplify issues of racial equity, affordable housing, climate action, and strategic planning. Mary first came to Boulder in the 70s when she was studying mechanical engineering at the University of Texas, El Paso. And during her studies, she was recruited by the International Business Machines Corporation to work in Boulder for the summer and quickly fell in love with the community. After finishing her master's in mechanical engineering from the University of California, Mary returned to Boulder in 1982 and has called it home ever since. Her engineering career covered a range of assignments from developing mining instrumentation to designing juvenile products to operations management for a small startup in Boulder County. And she worked in engineering-related businesses until 2008. After retiring from her engineering career in 2008, Mary began a second career in public service in 2009 when she was appointed to the planning board for 5 years and served as chair before her election to council. Throughout her time on council, Mary served as mayor pro tem from 2015 to 2016 and has served on internal city groups such as the Charter and Elections Committee, Council Employee Evaluation Committee, Financial Strategy Committee, and the Guiding Coalition for Racial Equity. She's also represented Boulder on the Colorado Chautauqua Association, a city partner organization. During her time in Boulder, Mary has held positions with nonprofits, including Growing Gardens of Boulder County and Via Mobility Services. She has served on the board of Ego Car Share and for 3 years participated in committees that award grants for the Community Foundation of Boulder County. In 2012, she was chosen for a Rose Community Foundation Fellowship to develop a transportation project that focuses on the well-being of Latino elders. As the city has been seeking more and better ways to engage new and different people, Mary's strong ties to the local Latino community have been an incredible asset in that effort. Over years of relationship building, Mary has helped the city identify and address barriers for engagement, which has led to increases in resources such as translation services and programs such as the Emergency Response Connectors and Community Connectors and Residents. These programs and resources have helped augment city services to better address and support the unique needs of the Latino community. So we, the City Council of the City of Boulder, Colorado, recognize, honor, and appreciate Mary Young's contributions to the city, whose dedication to creating a community for people of all backgrounds has been a hallmark of her service.
Thank you, and I didn't expect to get emotional, but here I am. So, I just want to say that what I've always said about serving on council is that it's always challenging and sometimes gratifying. And tonight is certainly a gratifying night, not just because it's my last meeting, but but because it's been so wonderful to work with my colleagues, all of you, and then all of my past colleagues throughout my 8 years on city council and 5 years on planning board. I could have run again, but I just felt that starting my service in the aftermath of the 2013 flood and ending it with a worldwide pandemic was probably a good bookend to each other. So I shudder to think what might have happened. But in all seriousness, I want to echo what Adam and Mirbai have said about the community that we live in, and the strong voices and how we move things forward in this community. But I also want to stress that we should think about how we do this collaboratively, how our work on council is amplified by the community, and it's actually done by our city staff, which is so amazing. And we should always remember that they're the ones that do the work, and so they should be part of the collaboration. So thank you, and thank you all. It's been just a wonderful honor to work with each and every one of you. And I will miss it, but I'm going to have a lot of fun. Thank you.
Thank you, Mary.
All right. I'm not gonna cry. Next, we have, sir, the declaration in honor of Sam Weaver's service on the Boulder City Council, and that'll be read by Councilmember Yates.
Okay.
And Bob, we do ask on behalf of our interpreters that you watch your pace, please.
Watch my pace. I'll talk really slowly. But this is a very long declaration, so we'll take our time. Sam, I want to read the declaration first, and I'll have a couple of words like other speakers have had. So this is a declaration on our mayor, Sam Weaver, and his service to our community. In 2013, Sam Weaver was elected to a 4-year term on the Boulder City Council. And Sam was reelected in 2017 to another 4-year term. Throughout his 8 years on council, Sam has been a strong and engaging city leader and has since been elected to serve as mayor in 2019. As mayor, he has guided the city through some of its most challenging times in recent history. With a bachelor's degree in science from the California Institute of Technology and 10 years as a professional researcher in the electrical engineering department at the University of Colorado Boulder, Sam's education and experience has centered on environmental, technical, and business issues. Shortly before joining council, Sam began his career with the city in 2012 when he was appointed to the planning board. He also participated in the City of Boulder Excel Working Group, which guided the city's efforts to municipalize their electric grid system. Sam served on the board of Clean Energy Action, a nonprofit entity working at the local, state, and national level on issues relating to clean energy and climate change mitigation. Outside of council, Sam is the president, CEO, and co-founder of Cool Energy, Inc., a power conversion equipment company located here in Boulder. Sam sits on the board of directors of Proton Power, a biomass power and fuels company. Sam served as a volunteer firefighter for 15 years, including one term as chief. And Sam has been active in the Boulder County Democratic Party Get Out the Vote efforts ever since 1994. Sam's spirit of entrepreneurship and service is reflected in his active involvement in the Colorado technology and business communities. He co-founded Colorado-based company Colorado Photonics, which he has been named as an inventor on 30 issued patents. And Sam has held positions on the boards of the Colorado Solar Energy Industries Association and the Colorado Clean Energy Development Authority. During his time on council, Sam has served on internal city groups, this is only a partial list, such as the Council Employees Evaluation Committee, the Intergovernmental Affairs Committee, the CU South Process Subcommittee. Sam has also represented the city on regional groups and partner organizations such as the Colorado Municipal League's Policy Committee, the Metro Mayor's Caucus, National League of Cities, the Rocky Flats Stewardship Council, and the Northwest Mayors, Commissioners, and Coalition. Page 2. In all of these regional capacities, Sam has proven himself articulate, influential, and a well-respected leader, capable of shaping policy proposals and garnering the support necessary to see them adopted. The city's regional, state, and federal policy efforts have benefited tremendously by Sam's tireless efforts. Now I want to say a few personal words myself as well. Sam, you probably have had the toughest two-year term as mayor as any mayor has since the founding of Boulder. We had a COVID crisis, which we just talked about. We had a terrible, terrible shooting at King Soopers. We had a riot on the Hill. We've had some really, really tough goes. And through it all, you've led us, and you've kept us together, you held us together. Since the founding of this country, philosophers have debated whether time makes the person or the person steps up to the times. And I think in your case, it's a little bit of both. You've held us together. You've done what's needed to be done during our times of crisis. And it's not just our community, it's also the 9 of us here on council. You've mentored us, you've built bridges. When you see rough spots, you patch them over, you've brought people together. Oftentimes you come up with creative solutions to seemingly intractable problems, and resulting in 9-0 votes, oftentimes at different places than where we started. So I appreciate your creativity. And just as a personal note, Sam, you are not only our mayor, but you're my friend. And while one of those is going to end here in about a week, the other one will last a lifetime. So on behalf of myself, on behalf of a grateful council, on behalf of a grateful city staff, and on behalf of the entire community, thank you.
Well, thank you, Bob, and thank you all. And I'm going to pull out a cheat sheet because I don't trust myself to get all this right. But I want to start by saying thank you to some people who really deserve thanks, starting with my wife, Maggie. She has been with me through the good times and the hard times, and there have been some of both, and I really appreciate the support from her. My fellow council members, past and present. So there have been some former council members who mentored me when I first got on council, and then this council has helped me through a very difficult time that the whole city had, and so thank you all. I want to especially thank Bob and Rachel for the work that they did in partnership in discussion with some big counterparties, Xcel Energy and the University of Colorado. So appreciate all the time that you guys both put in on those hard projects. And I want to give a special, incredible shout out to my friend and colleague, Mary Young. Mary and I have been on a journey together. Mary talked me into applying for the planning board in the first place, and she has been my partner in discussion about tough issues the whole time I've been on council, and it has been super helpful to me. So thank you, Mary, directly for that. And then staff, there's way too many staff members to thank, but the staff here at the City of Boulder is passionate and dedicated and incredible. And I especially have to thank Jane Brodigam and Chris Meschuk and Nuria Rivera Vandermeid, because without them, I would never have been able to get through the last 2 years. And so, Chris, especially to you for the work that we did together after the King Soopers shooting. You were stellar, and I really appreciate what you did for the community and for us. I'd like to remind us all that the staff is the tip of the spear. When there are emergencies in Boulder, the police and fire department get called out, but right immediately after them comes the staff in the city manager's office. So I want to thank you for all the work that you do. I just want to say a few words about what I've learned. Well, I've done this tour of government service, and that is that government service is about the people and doing what's best for the people, and it is that first and foremost and forever. I want to quote Jean-Paul Sartre in his work called No Exit, and he said, "Hell is other people." Now, some days on council, it's felt that way. But later, when he was asked about his famous quote, here's what he had to say. But that is only that side of the coin. The other side, which no one seems to mention, is also heaven is each other. Hell is separateness, uncommunicability, self-centeredness, lust for power, for riches, for fame. Heaven, on the other hand, is very simple and very hard, caring about your fellow beings. One of the most personally fulfilling council projects for me has been working with the tribal consultation that we did with the original indigenous inhabitants of the Boulder Valley and their descendants. And one of the tasks set jointly between the city and that group of tribal governments was to rename Settlers Park. And the name that the tribal leadership settled on was the People's Crossing, which is, to me, an inspired, beautiful, and symbolic name to be given to this place. And I like to think that, you know, we're at the intersection of history and place. And it's in this town that has been built up around the People's Crossing. Council, we're simply the custodians of this place, and we're the custodians in the name of the people who are here now and who will come. We do not own Boulder. We're of Boulder, and I'm thankful to be lucky enough to be a small part of the story of this beautiful place, as we all are. So thank you all so much for working with me through these last 2 years. Maria?
It is hard to follow that, Mayor, but I just want to say on a personal note to all our outgoing council members, it has been such a pleasure to work with you. Got it? It's been such a pleasure to work with all of you, and I just wanted to appreciate the trust that you have given me, the support you have given me in my 6 months here, and my continued commitment to hopefully not let you down as we move forward. More importantly, perhaps than me, I will say that on behalf of the entire city organization, we cannot thank you enough for your leadership, for your kindness, for those moments where you have often disagreed with us and challenged us to be better, for those moments where we have been in agreement and we have faced difficult moments with our community, for your voices. And we hope to continue to hear your voices and your support as we move forward and you move on to more exciting and perhaps more relaxing things as we move forward. But I really just want to express how thankful we are for your leadership and your insight and your commitment. Yours are jobs that we perhaps do not want. And we're so thankful that you have taken the time to serve your community.
Thank you all.
Can I just suggest, in very typical Sam fashion, he didn't give us time to applaud his speech, and so can we go back and give him his due applause? One more.
All right, well, it is our last meeting, so we're taking a little time to enjoy each other and enjoy what we've come through. So with that, could you please take us to the next item?
Hard act to follow, sir. Next, we have item 1G, which is the discussion of confidentiality issues related to public requests for information regarding the recently deceased unhoused pregnant woman.
Thank you, and this is a hard pivot, right, as we move into a more difficult conversation. As everyone knows, we've recently suffered a tragic loss in our unhoused community. I want to acknowledge the sadness and frustration for many that are feeling how much we communicate, or frankly, how much we have not been able to communicate on this issue. I'll be turning to our city attorney's office to explain more about the constraints that keep us from currently sharing more about this tragic loss. But at a high level, I want to share the following, and because it is so sensitive, I'm going to end up reading a little bit here. On the evening of October 11th, 2021, police officers responded to a tragic death call. The report came in originally about one deceased individual in a tent on undeveloped private property at 5847 Arapahoe Avenue. Subsequently, the officers discovered there were two bodies inside. One was an adult woman, and the other appeared to be a newborn infant. The mother and baby are currently at the Boulder County Coroner's Office, who has the responsibility for determining and reporting out on the cause and manner of death for any fatalities in our community. We don't know yet when the coroner's report will be released, but do know Boulder Police continues to work in collaboration with the coroner's office as the case remains open pending the coroner's final report. I can also share that Boulder officers were familiar with the woman who died and had attempted on more than one occasion to connect her with medical care and treatment. We've been asked by the family to not share any further details about the mother and her baby, and have additional limitations on how much information we can legally share about what, if any, services the mother received. We know the lack of more detail when we as a community have suffered such an inexplicable loss is frustrating for you and the community. And for more information on some of the legal constraints we have, I'll turn to Sandra Yanis, our interim city attorney.
Thank you, Nuria. Can you hear me? Hopefully you can hear me. Thank you, Nuria. Jean Bankart, Deputy County Attorney with the Boulder County Attorney's Office, has graciously offered to participate in tonight's meeting and provide information regarding the legal restraints of disclosing information on individuals and their use of social services. She heads the legal unit for the Family and Child Services Unit at Boulder County Department of Housing and Human Services. Once Jean is done, I will then address the legal restrictions related to criminal justice records related to the Boulder Police Department. And with that, I'll hand it off to Jean.
Good evening, Mayor and City Manager, and the rest of City Council. I'm Jean Banghart. As Sandra said, I'm Deputy County Attorney for Boulder County Attorney's Office, where I focus on human services issues. And I'm here today because of the very tricky and oftentimes frustrating issue of confidentiality regarding benefits records and human services records for those in our community. Colorado laws are very strict about who can get records concerning persons involved with county social services agencies and those who've received benefits and services. The restrictions include county child protection records, county child support enforcement records, county adult protection services, and county benefit and subsidy records. And these laws are scattered all across our civil codes, our regulations, and our legal statutes. And they can be extremely frustrating, but there's a really good reason for these strict confidentiality rules. Though it's unfortunate, the reality of society today is that it places great stigma and prejudice on those who receive social services benefits and support. That is the reason why there are these strict confidentiality rules. And in particular, it is to prevent people from not wanting to get social services and not wanting to report others who need social services from obtaining those services. If names and details and information regarding persons involved with social services and benefits were available to the public, those disclosures, they create a disincentive for those in need and for the most vulnerable in our community to receive those services that they need. Confidentiality laws also encourage members of the public to report concerns of suspected abuse and neglect of children, as well as at-risk adults. Many reporting parties would hesitate or not make reports of suspected abuse if there were concerns that the names and the details and information regarding persons about whom they are making the report were available to the public. And so disclosure of the information creates essentially a disincentive for people to make necessary reports to help those who are vulnerable in our community. There's numerous laws. I'm not going to go through each individual one. You would all be asleep. But I did want to put to your attention one law in particular, is that county departments are required to apply the confidentiality laws equally to groups or individuals such as legislators, governmental authorities, the courts, law enforcement officials in some contexts, even county commissioners in some contexts. And violating the confidentiality rules and statute is serious. They can result in criminal prosecution for either the person requesting the confidential information or for the agency employee who supplies it. It is a misdemeanor to improperly release confidential information. So that makes this all the more frustrating because I know that this community really wants to serve members of its public and know when and to know when there needs to be different services in place or different policies in place to help, especially the most vulnerable in our community. I will let the council know that Boulder does have a local child fatality review team. That review team consists of representatives from public health and county human services, local law enforcement agencies, the district attorney's office, school districts, and county coroner's office. And the purpose of that team is to identify prevention recommendations regarding child fatalities. That team does get access to these records. They can get access from records from the coroner and hospitals and human services and law enforcement. And they are charged with creating a report to find out if there is any means by which any child fatalities could be prevented. And they also provide information from that report to state child fatality review teams, which in turn then provides information to the state legislature and the governor's office. But I wanted to let you guys know the background as to why it is oftentimes difficult to disperse or just let anyone have information that people feel that they need to have in order to do their jobs. It can be frustrating, but there is a good reason behind it. So that's the background with regard to confidentiality of people receiving benefits, people involved with human services, adult protective services, child protective services. There's other laws with regard to law enforcement, which I believe Ms. Lanes is going to talk about, but that's with regard to services is the information that I've just provided.
Thank you so much, Jean. Appreciate your time here tonight. Thank you very much. Do any council members have any questions for Jean?
I see Aaron and then Mary. Aaron?
Thank you so much, Ms. Banger. Really appreciate you being here tonight and giving us that information. And I'm also glad to hear about the Child Services, the Fatality Review Board, because that was going to be one of my questions, is whether people are going to be looking into whether there are ways to prevent a similar tragedy from happening in the future. So I'm very glad to hear that is underway. And I guess I don't know if this question that I have is for you or some other member of our city staff, but when the death was first announced of what we later learned to be the mother, there was no mention of a newborn. Was that required by state confidentiality laws, or why didn't that happen, I guess is my question.
So the laws that I'm talking about and I'm referring to are the laws regarding what services people have received. It's not with regard to what information can be provided from law enforcement or deaths in general to the public. So with regard to child, so Your question really refers to something outside of, what benefits someone has received and what services someone has received.
I'll wait for Sandra.
Yes, thank you. I'd like to follow up with that and just let you know that I'm going to be talking about the Criminal Justice Records Act, and I think that that discussion will address your question.
Great, thank you.
Anything else, Aaron? No, Mary?
I think I'll wait for Sandra's presentation.
Okay, sounds good. Thank you again so much for being here, and Sandra.
Great, thank you, Jane. Appreciate it. I'm going to talk a little bit about the Criminal Justice Records Act as it relates to the police department and criminal justice. And as Jean mentioned, the Colorado laws are very strict about who has access to records concerning individual interactions with criminal justice agencies. In the case of criminal justice records, the Colorado Criminal Justice Records Act, or CCJRA, governs. CCJRA applies only to records kept by criminal justice agencies, such as the Boulder Police Department. All other disclosure of records kept by the city are governed by the Colorado Open Records Act. CCJRA allows for more discretion than the Colorado Open Records Act, as criminal justice records are more sensitive than records of city business. CCJRA allows criminal justice agencies to withhold records that are not quote-unquote official action if releasing would be contrary to public interest. The CCJRA is more discretionary for several reasons. First, the records controlled and maintained by criminal justice agencies are more sensitive in nature and contain personal information that could negatively impact individuals if released. In the case of ongoing investigations, releasing the records may impact the integrity of the investigation. When a request is made through CCJRA, the custodian first determines if the record requested is an official record or not. If it is an official record, the document must be available for public inspection. The Colorado Supreme Court has held that a criminal justice record must be open for inspection unless the privacy interest or dangers of adverse consequences outweigh the public interest. If it is not an official record, the custodian uses a balancing test to determine whether the agency will allow the document to be open for public inspection. The factors of the balancing test include, number one, the privacy interests of individuals who may be impacted by a decision to allow inspection. Number two, the agency's interest in keeping confidential information confidential. Number three, the agency's interest in pursuing ongoing investigations without compromising them. Number four, the public purpose to be served in allowing inspection. And five, any other pertinent consideration relevant to the circumstances of the request. The custodian may differ depending on the type of record requested. For example, Boulder Police Department Records Department for police reports and the coroner's office for autopsy reports. In the present case, the Boulder Police Department investigation is ongoing into Miss Aldana's death. As the custodian of criminal justice records, Boulder Police Department does not release these types of records in open cases. Under CRS 24-72-3055, public release of these criminal justice records would be contrary to public interest. The records are criminal justice investigatory files compiled for law enforcement purposes, and such disclosure could jeopardize the integrity of an investigation and or a subsequent prosecution. Additionally, one of the factors the custodian weighs is the privacy interests of the individual who would be impacted by the release of the information. In this case, the family of Miss Aldana has requested the information of her life circumstances or death remain confidential because of the impact that releasing the records will have on the grieving family. So for all of those reasons, the information, well, the police department has received several requests for information related to this case, and in each of those circumstances, those requests have been denied. Does council have any questions?
Aaron.
Thanks for that, Sandra. That was helpful. My question from before stands, which was not about the release of criminal records, but why it was not made public that there was the death of a newborn along with the death of the mother. Because I'll just say that to my lay understanding of things, it seems like when there are deaths in public, like someone falls in El Dorado Springs, for example, that information is made public. So and so was deceased, and here was their name. So why wasn't that information released?
I don't have personal knowledge of why that was not released. However, I would imagine that the balancing test would favor in not releasing that information if it were to compromise the investigation.
I guess I don't quite understand how releasing that piece of information compromises an investigation.
Well, it could or it couldn't. I don't know, since the investigation is ongoing.
Okay, well, maybe we could get some follow-up information on that, because I think there are a number of folks in the community that were concerned about why kind of the significance of the event wasn't made known to the public.
Mary.
Thank you.
Thank you. There is one just matter I think to follow up on that might go to your question, Councilman, is once information is released, it can't be taken back. And so I do think that sometimes, and I'm just speaking in generalities, not with specificity here, but entities tend to err on the side of caution because not knowing yet if it's going to be important for an investigation or not important for an investigation. Because if information is released prematurely, then they could unwittingly be in violation of a statute without intending to have been in violation of the statute. Again, I know that this is unsatisfying. I know it is frustrating. I'm just putting the reality of what the laws are out there and what our different agencies are dealing with in deciding about release of information.
Okay, thank you very much for that. Mary and then Rachel. Mary.
Thank you, Jean and Sandra, for those presentations. One of the things that has come up and what entered my mind as well when this occurred was to help, in order to help the city become informed about what gaps in services or the city or the state or whatever jurisdiction, how the information that is released or not released can inform that, and how can legislators, I know Jean mentioned that it eventually gets to legislators to inform them, but how is information filtered, I guess, to get to the appropriate hands that can determine and identify the gaps in service that are identified through this incident?
I might be able to speak to that, and it goes back to the local child fatality review team that has specific requirements in place as far as what records they are to obtain from which sources. I think I said earlier, it includes law enforcement, coroner records, hospital records, human services records. They are specifically allowed to obtain those records, and they're charged under statute with evaluating the means by which the fatality may have been preventing. and reporting those case review findings as appropriate to public and private agencies that have responsibilities for children, and also to make recommendations to agencies, including state child fatality review teams, who in turn then provide the information to the legislature. But the system that is in place with these fatality review teams, both the local child fatality review team and then in turn the state child fatality review team, is so that these issues are investigated in a systematic, careful way, gaining all the information that is needed, as opposed to just having partial information. So for example, if council here had some information but not all information, it could be unhelpful, actually, for the council to be recommending certain services if they don't have the full story. That's why the local child fatality review teams are in place. There are certain requirements that they have to provide information to national data services. They have to list any systems issues that were identified through the process to the state review team, and recommend appropriate improvements to necessary agencies for training and resources and services in the future. So that is how it is set up through the statute. I'm not saying that that is a perfect system. I'm just explaining what the law has in place right now in order to address some of those concerns.
Thank you, Jean. I just have a quick follow-up, and that is in this particular case where the death involved the death of a child as well. This case would also involve the death of an adult, and you only mentioned the child services or the child fatalities reviews. What about the adult fatality portion of this particular case?
So I can try and address that question, because I think it really comes back to the Criminal Justice Records Act. And as I mentioned, whenever there's an ongoing investigation, there's information that can't be released because the police have to do their investigation and take the time that's appropriate to do that, however long that takes. There is also some laws related to the coroner's report and the fact that they are not allowed to, even after the report or the coroner's department finalizes the autopsy report and is then subject to CORA, there are even then restrictions related to what information they can release. For example, there might be medical information that can't be, shared and that sort of thing, and other confidentiality issues related to HIPAA. So I think that the information related to the adult would still go back to the Criminal Justice Records Act and the laws that apply in that area.
And so how would you mentioned mostly information that would be kept confidential, and what if some of that confidential information actually has or provides some insight into how you can improve services or where there are big gaps? How does that get out in order to be able to serve people better?
It's a delicate balance. I think that there would be some information that would be able to release once the investigation was complete, and those records would be available and no longer under the hold of the Criminal Justice Records Act. But I think that there's no good answer to your question, honestly. I think that we have to abide by the confidentiality laws that are in place. And if there are some overlapping restrictions related to social services, as Jean mentioned, then the city also needs to comply with those laws.
Could I colloquy? So I think, of course, what we're driving at here is how we find out what's actionable and improve the system in the future. And so I would just ask, what role do confidential memos play? So we have gotten confidential memos that disclose to us more details of different situations than can be put out publicly. But I think what Mary's chasing after and what I'm interested in is how do we find out what the gaps are and how do we use the events to track down the gaps? And so if you can't disclose publicly what was found, is it possible to give policymakers details under confidential and then let the policymakers bring forward policy changes? I think really what we're hunting for is how do we find the systemic problems without betraying confidentiality?
So if I may, I'll take a stab at it unless our attorney hits me under the table. But I'll say this, that in terms of that, I understand the question in terms of how do we actually gather, how do we learn from this? And what I can commit and say to you is that we're actually going to continue to talk both with our HHS partners, our county public health partners, the coroner's office, our city attorneys, our police departments to figure out where are, if any, are those gaps and how do we bring those forward and how do we address those? And certainly the role of confidential memos is precisely that, to bring you information. So we will continue to work with our partners to figure out what, if anything, we could do to shore up whatever gaps there may be in the future, whether it is children or it is adults. We want to do all that we can to learn from tragic situations like this. And then the other thing I'll say too is that at a very high level, I will just note that investigations evolve over time, right? When we first find out, we could go somewhere and there is an active investigation and we do not know whether or not there is active evidence of foul play or not. That could change over time, but what is said in that moment may be different as an investigation evolves, and then that perhaps is turned to the coroner's office for further investigation. And as we continue to move forward in the investigation, whether that moves from criminal to now pending a coroner's report, or if there is a coroner's report in the future, and again, I'm trying very hard to not speak about this case in particular. If there were a report that were to come back that was unusual and then that opened the case again for a criminal investigation, that is why police keeps their investigations open for that possibility. It could perhaps also explain why some details emerge subsequent to what is initially reported.
Mary, you have follow-up?
Yeah, that's very helpful, Nuria. Thank you. I have a follow-up to the follow-up. So we talked about how all of these current laws may or may not inhibit the identification of gaps. So how does one identify or what process is there to identify any kind of flaw, I guess, or improvement that could be made on those confidentiality laws themselves? So in other words, it would go like to state legislators to be able to change those kinds of laws. So how are potential changes in those statutes identified?
I myself don't know the response to that question. I know that is different states have different laws on what that looks like. And what I would say and suggest is that as those are found internally, and I don't know if we still have our county partner on the line, but internally I suspect that whatever is discovered there then moves up if there is something to shore up, whether that is on a local level or whether that is at a state level, to change those laws. And that would certainly be one of those things that we perhaps would bring to you all and your attention, that we would think about how to bring to our lawmakers at the state level. And there's not a great response because we are not in part of those confidential conversations. But I suspect that as that emerges, we shore up those laws and we share with our respective policymakers. I don't know, Sandra, if you have more on that, but.
No, I didn't have anything else to add.
Thank you.
Rachel?
Thanks, Sam. And thanks for asking the questions about the gaps and how we will get answers. I really appreciate that. So I have noticed that everybody's sort of avoiding saying the individual's name who passed away, and I assume that that's out of respect for the family's preferences. But so I will just use her first name and hope that that's okay. I did want to just express deep condolences to the family and friends of Jessica and the community who may be watching and grieving as well. So just wanted to take a moment as a council and express our condolences. And then I do have a couple of questions. First is on the city side. This it feels a little bit to me like we're circling around a question of sort of transparency meeting equity considerations. And we had an unhoused vulnerable individual pass away outside with either a newborn or stillborn infant, and it wasn't released. And I'm hearing the explanations, but I also feel like during my own tenure on council, like if there's a stabbing, we get that information out pretty quickly, and we'll say, you know, there was a stabbing, 2 individuals were involved or whatever, and we don't circle around the privacy and criminal justice considerations. And I understand this is an ongoing investigation, but a stabbing would also be, or you know, anytime there's a crime in the community. So I'm struggling with why this particular situation, there's such a lack of transparency. And especially like if an unhoused individual is a perpetrator in a crime, that information seems to get out very quickly, and you have an unhoused individual who is deceased along with a newborn, and we're really kind of circling the wagons around that information. And I'm just struggling to make sense of why this is such a disparate situation. So I don't know if anybody can speak to that.
And before you jump in, I'll just say, once we get through this, Kurt has his hand up, so I'll call on Kurt after this. But Nuria, if you'd like to start.
Oh, I appreciate that because I can't see Kurt myself. I'll say that I appreciate the struggle, right? How do we think about, how do we share out information? I think how we treat, again, on a general level, how we treat calls that come in that are active criminal investigations, when there is an accident on the street, when there is a homicide, and we are looking for witnesses and treating it as an active criminal investigation. That detail is most generally put out and put forth in community because we're wanting community to help us search for witnesses and get statements. For calls that perhaps come in as a medical call or for calls that come in for unattended deaths, the same way that they might come in for an overdose or a suicide, whether or not they are outside or whether they are in the privacy of a person's home. Those are not calls that we put out publicly. As a matter of record, we are not looking for witnesses in that case. It is not an active criminal investigation, even though it could be an open investigation pending a coroner's report. I hope that helps.
It does a bit.
Rachel, can we get a Kurt and just see what you wanted to? Sorry about that. It's a little confusing with this hybrid thing. Kurt Fernhaber, I see that you're in the meeting, and hopefully you can get put up on the screen, and you had your hand raised.
Yeah, thank you, Sam. I can't seem to turn my video on for some reason, but hopefully you can hear me okay.
We can hear you, yep.
So I wanted to respond and add a little bit more to Mary Young's question about, you know, looking at gaps in the system, and that's one of the real purposes that Homeless Solutions for Boulder County was set up. We have, while we won't look necessarily always at individual situations, we'll look at trends or things that we're seeing And those are brought to the executive that meets on a monthly basis to really look at areas to improve services and fill those gaps. I'll just give one example of what that looks like. And you recently had a presentation from Judge Cook, and one of the challenges that they were having with their navigators and working with individuals that had interfaced with the criminal justice system is when they're ready to get individuals housed, they sometimes couldn't find them. And it took some time to find them. They would lose clients in the process. And so she was able to get funding to fill that gap, to put individuals who are on that track straight into hotels, support them in hotels until they got into a housing solution. So there's many gaps that are out there, and sort of the purpose of Homeless Solutions for Boulder County is to identify them, to change our programs over time, and in some places even start new programs. The Be There program is a program that was started a year ago, also there to fill gaps. But it's an ongoing conversation, what we hear from service providers and the individuals who are doing that work on the field on a every day, to understand how to change for that. And I'm glad that we have a system in place to look at those specific services that are completed not just by HHS at the county, but also our service providers that work in the community.
Thank you, Kurt. Rachel?
Thanks. I had a couple more questions, I guess, on the transparency front. So when I first read about this, I went to the website that used to have our call log and police blotter, and it's not there anymore. And so that just concerned me that maybe we don't have as much information available to journalists and the public as we used to. So wanted to know when that got taken down, or if that's going back up, or why I can't see what calls came in.
So I appreciate that question because I've learned a lot about the blotter now that I've been here and been asking. So I'm going to pull up some notes here about it, but my understanding is that prior to 2020, the police department had a blotter. It was a Word document. Many people were able to access and input data into that document. So there was perhaps some lack of inconsistency depending on who put more information or less information out there as that moved forward. It was also an extremely manual process, and so that took a variety of hours just to compile and put out, and did not perhaps include all the calls that came in, I guess, because there was some discretion involved as that was moving forward. In 2020, the police department partnered with our innovation and technology department to sort of make some significant changes to that. And what emerged was a decision from our now police chief to make sure that all calls are reported out. And that is that comprehensive call log can be found on the police call data 28 days. And that is on our City of Boulder open data. It is a dashboard. It does not leave any cases out. And folks can certainly take a look at that and look for those cases as that moved on. That data then is automated, and so it is not subject to that discretion of some folks put more information than not as that moves forward. So actually, I believe that it was an effort to increase transparency than not. The blotter then was kind of unnecessary, as it was sort of a flawed document by itself. And because it was time consuming in the beginning of 2021, when resources became scarce, that was eliminated because we had this other tool.
So if I go to that other tool, would it have some narrative in there that there was a call in and an individual was deceased, or an individual and a baby, or is it just data saying like where a call was called into?
I believe it is data, and it would show whether it was what type of call in. So for example, if it was a medical call, it would be there and it would occur on that date. And certainly anyone interested could take a look at that call log for any call data that we have and request more information based on that. And then it would still go to the city attorneys to see if that was something we could disseminate or not disseminate.
So my concern is that if somebody saw that data somehow and was able to extrapolate from it that there were 2 deaths that night, we wouldn't give any more information because we're not giving much more information. It sort of feels like in this situation it was almost an accidental release of information or a press leak, perhaps. So I guess if it's just data and there's no narrative to it, I don't know if our answer is we're not giving more information. It still feels like a loss of transparency. So I guess I would request that we look at reinstituting that level of transparency. And I think that's all my questions for now.
Anyone else on this? Any questions for the county, city attorneys? Okay, let me just check Zoom here real quick. Not seeing nearby raise her hand. So with that, I think we are ready to move on to the next item. Thank you so much, Sandra, Nuria, and Jean. Appreciate your time and thanks for being here. Excellent. So any motion, conversation about the consent agenda?
I'll move the consent agenda.
Second.
All right, we have a motion and a second on the consent agenda. The only item on the agenda tonight is the third reading of the restaurants and parks item, and I believe this is a roll call vote. Is that correct? Let me check on discussion. Any discussion before we go forward? Okay, I see none. Walk us through the roll call, please, Alicia.
Yes.
Thank you. Councilmember Friend, yes. Nagel,
No.
Sweatlick,
Yes.
Wallach, Weaver,
Aye.
Yates,
Yes.
Young,
Yes.
Brockett,
Aye.
Sir. Consent agenda passed 7-1.
Excellent. Thank you very much. And I believe the last item is matters from mayor and members of council. So I will take that one. First tonight, we have mayor and mayor pro tem statements of interest. These are not intended to be speeches or anything of the sort. They're just indications of interest. We've tried to make sure to be careful to include council members elect as well, so that they know that tonight the rules are that anyone who would like to be the next mayor or mayor pro tem needs to put an announcement out on hotline by midnight tonight, which says that. I think everyone on the current council and all the incoming council members know this. We have seen a few hotlines, but at this point, any council members like to indicate your interest in being the next mayor? Bob.
Well, as Sam said, we in the old days we used to give long speeches, and then people realized that was pretty boring. And so a few years ago, council adopted a rule that says just put it up on hotline, which is for those in the community, that's our communications tool that everyone can see. And so so far, I know the deadline is not till midnight tonight, but so far I think Aaron and I have both done hotline posts indicating a desire to be mayor, and Aaron might want to say something in a minute. And then Rachel has indicated interest in being elected as mayor pro tem. For the community, this will be the last council appointment of mayor and mayor pro tem. I think mayor pro tem will still be a council appointment, but starting in 2023, the mayor will be elected directly by the people. So I won't give a speech, but I just want to make an observation that I think Aaron did in his hotline post, which is it's really, really difficult to write things about yourself, right, Aaron? We want to put out your best foot and say, well, this is why I think I'd be a good mayor, but then you lose your humility pretty quickly, and so it's an awkward thing to do. So I just want to make one comment. I've known Aaron for 10 years. He and I have served on various organizations before we each joined council in 2015, and each got elected in 2019. And sometimes when you have a head-to-head competitive election involving two people or multiple people, you think, well, geez, I'm better than that other person, or I'll do a better job than that other person. That is not the case here. Aaron is a person of integrity, of wisdom, of honesty, of courage, of compassion. And I think this community would be well served by either Aaron or I being elected. And he's told me the same thing, and I really appreciate that as well. And so I would say to the council members here present who will be voting next week, and our new colleagues who will be joining us next week in voting, choose as you wish, but you can't go wrong. Thank you.
Thank you, Bob. And with that, Aaron.
Yeah, thanks so much for that, Bob. That was very kind. And yes, it is awkward writing positive things about yourself. I find that very uncomfortable. It took me a long time to get those words out on Hotline. But Bob, your Hotline post was excellent, and your qualifications are numerous. And I agree, the community will be well served, whichever of us is appointed mayor by our colleagues. And I look forward to working together closely along with the rest of council, regardless of how that goes. And I'll just say that one thing that I've appreciated about this council is that through a lot of difficult issues, we have worked together generally very productively. And you have not seen the negativity that you often see at the state and national level in the political scene. And I feel confident that in the next council that the mayor, whether it's Bob or myself, will show that form of leadership, will continue to productively work on the many issues that face our community without that kind of vitriol that we see at other levels of government. So thanks to everyone for consideration.
And as the current mayor for another week or so, I will say that I agree, having worked closely with both Bob and Aaron, that either of them would make a fine mayor. And so I think the city council and the city will be in great hands with either of them. Newly elected council members, if you want to stand for mayor, you've got about 4 hours to put out a hotline. Otherwise, these will be your candidates. With that, I would like to turn and see if anyone would like to say a word that they're interested in Mayor Pro Tem.
Thanks, Sam. And to Bob and Aaron, you'll have big shoes to fill, so good luck. Yeah, I was told no speeches. I am interested in standing for Mayor Pro Tem, so I would just direct the community to my hotline post if you are interested in reading that. Thanks.
Great. And thank you all for that. Newly elected council members, if you wish to stand for Mayor Pro Tem, you have 3 hours and 20 minutes to put out a hotline saying so. Otherwise, it will probably be Rachel, and that will be wonderful for the city as well. Okay. With that, we can move on to the last item. This was a suggestion by Bob Yates that we, as the sitting council, go over the council committees, both the internal and the external facing council committees. The goal of this is to just make sure that everyone on the who's continuing on this council and the newly elected council members coming in have an idea of what these committees do and what the assignments are, who's on them, who's going off. And often this takes a good hour and a half at the retreat. And one of the ideas here, I believe, in the next council is to get these assignments done outside of the retreat to leave more room to talk about the work plan. So with that, I don't know, does staff have a slide for this, or shall I just walk through? No? Let me see if I've got my committee list here.
There was a committee list on Novus. I don't know if somebody could throw that up on the screen.
It's on 5A. Sam, do you mind if I say a quick word?
No, go for it.
Well, just know, I think this is going to be a valuable exercise. We do have a whole bunch of them, so maybe each person, as they describe it, can be succinct.
Okay, great. And that's under Novus. And would it be possible to get that put up, or is that? And we can wait just a moment if we'd like. Okay, very good. We're working on it. Until very recently, I had this sitting on my desktop, and I was just cleaning some things up because why? I have no idea. Just a fall cleaning urge came over me. Aaron, I nominate you to be on that committee.
Second.
Most importantly, after reading these, new council members can't resign either.
Oh, it's way too late for that. Let me see.
Mayor, as we work on it, and I just thought that we were just going to talk about it, but we're working to put that up. But if I can fill a little bit of the awkward silence and just say something I was going to say at the end of the meeting, but I just wanted to shout out to staff that made this meeting happen as a hybrid meeting. There are a lot of staff that are not in this room, some in this room that are great, and some that you can't see because they're behind the cameras or helping on a variety of issues. And so we just thank you for letting us sort of do this trial run hybrid meeting. As we move forward, I know we will be back in chambers again next week on November 16th as we talk about it. But just huge thanks to staff that made this happen. It really is tremendous.
Yeah, thank you, staff, for that. And I will just say that this is not that easy to coordinate. Hybrid is new. We've done all Zoom. We've done all in person. And so this is new. I also have a question about that, Nuria, while we're here. Speaking of next week, where will the swearing in be? I know that the actual meeting at 6 o'clock will be here. Will we do the swearing in chambers as well?
Yes, we will.
Okay, so next week, for those who are interested in the community, at 10 a.m. on November 16th, we'll meet here in chambers, and we will do the swearing in ceremony for the newly elected council members. And then at the end of the swearing in ceremony, the meeting will be continued until that evening, and the new council will be seated that evening at 6 o'clock here in chambers. So on the 16th at 10, this council will convene, swear in the new council members, continue the meeting, and the new council will have its first meeting as a new council at 6 p.m. November 16th here. I see that we have the list up of the committees, and that's great. Thank you, staff. Sorry to spring that on you. Should have suggested that beforehand. So let's just start going down through the lists, and we'll have folks who are here talk about it. Mirbai, would you like to tell us anything about the Rocky Mountain Greenway Steering Committee?
I wish I could, Sam, but there's unfortunately nothing to tell.
Okay.
I didn't have any meetings, haven't heard much. So yeah, I guess an easy one, right?
In a sense, yeah. So I'll just say the Rocky Mountain Greenway, it's a federally funded program intended to create trail systems that go from airports through government-owned facilities to national parks. The Rocky Mountain Greenway is intended to go from DIA, Rocky Mountain Arsenal, to Rocky Flats, and then up to Rocky Mountain National Park. It had some momentum a couple of years ago. I think the momentum may be dying right now, so I think the new council might consider whether it's worth any council time for this one at all.
I was just going to ask that, like, we're not required to have a council member there. I see Carl Castillo as a staff alternate. Could we just designate staff to attend instead?
I think you want to ask that question when you make those assignments. I don't know the answer to that, but I think there are some of these where the staff can be and some they cannot.
And thank you for that. That might be helpful to know before our conversation next week, which are obligatory.
Yes, so I apologize. We have legal who is looking into that and actually compiling that list with what is discretionary, what is mandatory, what is legally required, and what, frankly, you can choose what not to do. And I just want to say also we have Carl Castillo on the line if there were any questions. But for today, my understanding was that we would just talk generally about the time commitments it would take and what kind of a commitment and what is the vision for those organizations, so that when we do have that conversation with the new council soon, that we can then talk about what do you want to keep and what do you not want to participate in.
Super. And this is one that sounds very discretionary. And with that, Adam.
Yeah, the Boulder County Consortium of Cities, it's a once-a-month meeting, generally 2 hours long. It is run by one of the Boulder County Commissioners, currently Marta Lochiman, and they send, the entire meeting is each city in Boulder County and Broomfield sends one elected official to sort of just information collect and share out information about current issues that the cities kind of share so we can learn from each other and help each other out. And it's a really good place to work together on collaborative countywide plus Broomfield efforts. We were working on a countywide minimum wage before the pandemic torpedoed it. Things along those lines. It's a really good place to just work on bigger issues than what we have just here in Boulder.
Right. Mark, do you have anything to add? No. Okay. And I will say that this is one of the interlocking set of committees that are involved with transportation. And so there may be a fair bit of work coming on this one just because we have some more money coming into the county right now. The Colorado Municipal League Policy Committee, I can speak on this one. It's been one that I've been on, I think, 4 years now. Carl helps guide the council members. This one definitely needs council members on it. Colorado Municipal League is the Colorado Association of City Governments. It is a very, very powerful voice in state politics. And so for incoming council members, current council members who like regional politics, this is a great way to get involved. Typically, it's about 4 meetings a year. There will be a midterm meeting, and then there's 3 that are associated with the legislative session, usually one in October, one in December, to kind of tee up statewide positions of CML for the coming legislative session and begin lobbying. And then there's usually a meeting in February or so, which talks about the current status of bills. So if you're a politically inclined person and you like state politics, this is a great position, and I think Junie is interested in continuing with that.
Sam, a question on that one. Is it a limit of 2 people, or could you have all 9 council members do it?
I think Carl's the right one to answer that. I do not know.
Yes. So Boulder, because it's a city of over 100,000, is entitled to have 2 representatives and an alternate. So right now you have 2 elected officials as your representatives, and I'm serving as the staff alternate.
And I will just say that this group used to be a fairly conservative group, and in the last 2 to 3 years, it has really changed. There was unanimous support from the policy committee, for instance, to lift the 120% rule on the solar installations. So anyway, it's a good group. And with that, Aaron, you want to talk about DRCOG?
Yeah, Denver Regional Council of Governments. This is a group that meets in Denver twice a month. It's been remote during the pandemic, but it's going back in person before too long. So there's a business meeting, 2 to 3 hours long, and then a kind of a study session that's more 2 hours long. And it's the body that's responsible for the distribution of federal transportation dollars to the region. So kind of a big deal, hundreds of millions of dollars at stake over the course of a few years. And it's also been tasked with distributing some of the state transportation funding that's been flowing in the last few years. So there's been some additional monies coming in through there, and now we've got more money coming in from the infrastructure bill and from the latest state transportation bill. So a rare case where we have more money than usual. So it's a pretty heavy lift. There's also a sub-regional forum where Boulder County representatives just meet as a group, which is more like 4 times a year for a couple of hours. So. But fascinating, really interesting. You get to work with all kinds of elected officials across the region on making decisions that really make a difference in our area.
Yep.
And Aaron, does it still meet at 7:30 on Wednesday mornings?
No, it does not. No, it's 6:30 p.m. and 4 p.m. Are the meetings.
Great. And Aaron has been our representative there for what, 3-4 years now?
6.
6 years. Oh, 6 years. Wow. And has carried the standard quite well down there. So thank you for all that work, Aaron. And then Metro Mayor's Caucus, that's pretty obvious. It's a mayor's group. It has focused on issues of regional interest, homelessness and transportation and climate, some of the top ones. It got far more active during COVID. I'll just put out there, whoever's mayor next, this group is in flux. One of the things that I tried to work with some folks to bring in are documents which live beyond a group of mayors, so policy documents that continue on forward. Anyway, whoever's mayor next, I would suggest that this is an important one to be going to. National League of Cities, why don't I turn to Bob? Bob, would you like to talk about that?
Sure. We have several council members who are involved in National League of Cities, and the nice thing about National League of Cities is it operates really in a committee format, and there's about 8 or 9 federal policy committees, and the 4 or 5 of us that are involved in that are each serve on a separate policy committee. So it gives us opportunity, and Boulder definitely punches above its weight in the National League of Cities. For a city of 100,000, we get mayors and council members from across the country. I think the conferences are usually about 5,000 people, and we parade in, we show up, parachute in rather, with 4 or 5 or 6 people, and we've had leadership roles on those committees. Matter of fact, our former mayor, Matt Applebaum, was on the board of directors of National League of Cities, something that we should continue to do. There is no limit to number of council members who can attend National League of City conferences or to serve on federal advocacy committees. It's a great way to meet congressmen and senators and to advocate for things that we care about here in Colorado.
Mm-hmm. And I've been on this for the whole time I've been on council, and would just say it is a great opportunity. It connects you with folks leading cities all over the country, and I would recommend that if you're questioning whether you'd like to do it, give it a try. Adam.
Yeah, the Resource Conservation Advisory Board is another Boulder County-based board, mainly focusing around topics of conserving resources, so recycling, zero waste, composting, all those types of things. There's a member from several cities appointed to the board. Currently, it meets once a month, but we're talking about reducing the amount of times per year that elected officials have to attend because it is a very policy and expertise-based board. Jamie Harkins from our city staff often does almost all the talking for me. I'm a fly on the wall because that is not my area of expertise. So it's a relatively light lift, but it is an important one. Just so happens that Boulder is ahead of the curve with a lot of this stuff. So that's also cool to be in the room hearing about all the things that we do. So good board.
Yeah, it is a good board, and let's make sure to put somebody on there who's interested in the recycling and materials subject. And then Rocky Flats Stewardship Council, I've been on this for 3 years, I believe, and maybe 2. I would say that most of the issues on this are not as relevant as maybe they once were. It meets 6 times a year, I believe, and sometimes those conflict with CAC. In fact, usually they do. It's Monday, usually at 8:30 in the morning. I would suggest to the new council you take a look at what the legal requirements are in this one, and maybe if staff could handle it, that might be a good thing. And then next one, Northwest MCC. When I first became mayor, Suzanne Jones told me, Sam, you must go to these meetings. This is another of those interlocking transportation committee groups, and so whoever's the next mayor really needs to attend these in person. It meets every month, and usually it's an hour and a half to 2 hours and very meaty transportation topics for our region. Commuting Solutions, Mirabai?
Yeah, so commuting solutions is what the name implies. It's working on different solutions of mobility across the Front Range, and it has representatives from, RTD, a lot, even private companies, along with a lot of members from other surrounding towns, so other council members. There'll be even, I've been at some of the meetings where our state representatives have shown up, and even our federal representatives have showed up. So it usually met like once a month. In all honesty, I haven't heard anything since, mostly since COVID. There's been very few meeting alerts that I've received. I've talked to staff and I haven't received much, so I'm not exactly sure what they're doing right now, but it was a meeting like once a month. So, and it was usually maybe like a breakfast meeting at 7:30 for 2 hours, maybe.
Okay, very good. Thanks very much. And then the next one is Mile High Flood District. I'm going to have Bob talk about that, please.
Sure. Mile High Flood District has traditionally been represented by the mayor pro tem. The Mile High Flood District meets once a month in Denver, although it's been remote recently, but they do tend to meet in person in Denver. It's a little like Dr. Cog that Aaron mentioned in that the Mile High Flood District is a taxing district, and it has tens and tens of millions of dollars to distribute up and down the Front Range for flood control projects. And again, Boulder gets a disproportionate amount of that money, and that's thanks to the representation we've had on the Mile High Flood District. Sam served on that, Mary has served on that, Aaron has served on that, I've served on that, Junie is now serving on that, Rachel or whoever's the next mayor pro tem will have the opportunity to serve on that. It's a collection of mostly mayors. Boulder has opted to make it mayor pro tem. They gather together once a month and help the staff of the Mile High Flood District plan the expenditure of millions of dollars of flood mitigation to protect our entire Front Range.
And I'll say it's fascinating. It's fascinating work because the history of flood control projects on the Front Range has a fascinating 50-year history to it. So,
I'll also note sometimes controversial.
Occasionally, yep. And so then we have State Highway 119 and 7 Coalition. Aaron, would you like to walk us through that?
Yeah, so these are both coalitions that are working on multimodal improvements along the State Highway 119 and State Highway 7 corridor. 119, it's going from Boulder to Longmont, and so it's the executive committee is City of Boulder, Boulder County, City of Longmont, RTD director, and CDOT director. So it's really interesting, meets quarterly, and that corridor is moving pretty swiftly towards construction and making huge progress. So that's really interesting. And then State Highway 7 is a broader coalition. It's every single municipality and county between the City of Boulder and Brighton to the east. So a larger group there. And that corridor is a little earlier in the planning process. So it's a little bit more of gathering steps rather than implementing, but also very interesting.
Thanks that I never had to go to one of those, Aaron.
I will say my attendance record is pretty good. I'll just pat myself on the back for that.
Aaron likes transportation. With that, we'll turn to internal city committees. So those were all external facing committees. Now we'll turn to internal committees. First one's audit committee, and I'll turn to Mark Wallach.
Well, the audit committee is basically what it appears to be. You are reviewing the audit procedures performed by our auditor, and ultimately the audit is presented to the council for its approval. I wouldn't call it a particularly heavy lift, but there are documents to be read, and to do it correctly, you do have to have some degree of immersion into everyone's favorite topic, which is financial audits. So it's for those who are looking to geek out on numbers, I guess, because there's quite a lot of that. But it's a reasonable lift if you're interested in that.
Yeah. And I'll say that this is one called out in the charter that we have to do, and so it's a good one to get on and learn some of the details about the budgeting and the way the finance in the city functions. Mirbai, would you like to talk to us about boards and commissions committee?
Sure. So I've been on that for 4 years, and it's pretty light lift. It's basically just working with another council member and meeting if there's issues. So if something goes wrong with the board, or if board members have any issues and need to talk to you, or it's even reappointing members. So let's say, people jump off boards because they move or other reasons. I'm working to kind of go over applicants and whatnot with staff to resubmit and maybe appoint someone before the next year's applications go in again, if it's within the 6-month time frame. So again, pretty easy lift. You just work with another council member, and you meet. It's mainly you meet upon the need. So there's no set meetings.
Great, thank you, Mirbai. And then Charter and Elections Committee, Rachel?
I'll take a stab at it. Mary and Mirbai might want to jump in because they've done it longer than me, and we're mentors on that. So this committee takes up when City Council decides that we may have an issue with the charter or with elections, and we may want to put something on the ballot. We will work with city staff and city attorney's office to come up with language that City Council will then look at and hopefully promote to the ballot for the voters to vote on. It's been my experience.
So the suggestions for charter changes can come from council members and can come from city staff, the community as well. So the suggestions can come from anywhere for the changes. It's also where council members who have suggestions for things to have the community vote on. So, for example, this year there was the council pay, which was one of the things that was brought forward by the charter committee. So it's not just charter issues, it's ballot issues that council members want to bring forward. It meets about 3 times, maybe 4 times, and it begins, the first meeting is sometime around first quarter, and meets again about a month after that and a month after that, and then you're pretty much done. So it's kind of a easy lift.
And I would say this is quite an important committee, and we'll only have one continuing council member on it. And I think the coming council will have a fair number of charter items that need to be considered and worked through. So please take a close look at this. It's a very important one. And then Council Retreat Committee, Bob.
I've had the pleasure of serving on this committee my entire 6 years on council. It's as it sounds, it plans the annual retreat, which is always in January of council. For a few years it was for Lisa Merzell and I, and then Mary Young and I, and now it's Adam and Rachel and I planning this year's retreat. The committee meets typically about 4 to 6 times in the fall, kind of right around now. We're meeting regularly now to plan the retreat, what the agenda looks like, working with a facilitator, working with city staff to ensure that our retreat, and it's not just the retreat, it's also the things like what we're talking about tonight, our pre-retreat exercises are well organized so that we get the work done in November and December, and then at the retreat in January, so that we can develop a workable 2-year work plan.
Great, thank you, Bob. And then next we have the Council Employee Evaluation Committee. I guess I'll take this one because I've been on it the longest, but that is to say not very long. I think I've been in charge of 2, and then COVID hit, not in charge of working on 2. We have 3 employees of the council, and this is the committee that does the performance evaluations. It is more involved than you might think because there's 360 surveys that are done by all the people who report to and work with the employees, and then we have to take that data, get it to council members. Council members do their own evaluations, comes back. There's professional help for it, but I will say it has always taken longer than I expected. So it's a relatively heavy lift, and it's compressed. It will start typically in the first quarter and need to be done typically by fall. And I know that we're talking about changing the schedule around a little bit, but this needs some folks who are willing to roll up their sleeves and do some work to be on this committee. And we have Bob and Rachel have stepped in to this role, but I assume you'll talk about that with the new council. And then intergovernmental affairs, Aaron?
Yeah, so another area where Boulder punches above its weight is in legislative advocacy. So we have an active presence at the state capitol each year during the legislative session, led ably and nobly by Carl Castillo, and the Legislative Policy Committee meets regularly during that session to review bills that have come out and decide whether they recommend that the city take a position on those. Also has a bit of a role at the federal level, but that's much less active. It's mostly being really hands-on during leading up to and during the legislative session, making some decisions on the fly, and in other cases for more significant things, referring a recommendation to the entire council. Really, really interesting if you like state politics and the state legislature.
Yeah, super interesting, and I'll say it's a nice fit with the CML Policy Committee. If you're on one, you could be on both and enjoy it. Okay.
Yeah, I'll take this one. So the Financial Strategy Committee, that was a new committee this year, and had a big lift in coming up with the process for developing the recommendation, and as well as the recommendation for the renewal of the infrastructure tax, which passed, yay! And so it's a relatively heavy lift. It meets once a month at least, and maybe more as things heat up, and meet for an hour and a half. And this year, with the renewal of the tax, we had intensive meetings to review all of the potential projects to be recommended. So if you are interested in the budget and how the budget develops up through the beginning of the year to when it's passed in October, and you like numbers and you want to geek out on that sort of stuff, then this one's for you. So I don't know if the terms will change or if they'll get flipped around, but the committee was 3 people, and it was decided that 2 would have 2-year terms and 1 would have a 1-year term. So that'll be something for the next council to decide. So
I would further that by saying if this is sort of the audit committee squared in terms of the in-depth look that you have to take and focus on numbers, and it is extremely detail-oriented. So it's a pretty heavy lift. Good place to learn more about the city, but you need to have the time to do it.
Great. And then, Rachel, you want to talk about the Hill?
Sure. And I would invite Mark Wallach to maybe join me on this. So when I started out on this committee prior to COVID, we were meeting once a month on Wednesdays for an hour, I think, kind of a 4 to 5 p.m. meeting. And then that was largely just discussing sort of things that that were not working well on the Hill and sort of ideas for change. And then after the riots happened in March of this year, we got a nod of 5 on this council to try and take some action to improve the situation on the Hill and focus on coming up with some legislative solutions and getting that neighborhood a bit more help. So it sort of evolved into something that's a heavier lift, and I'm not sure when they're meeting right now, and I'll turn to Mark for that because I actually, well, I guess after the riot, Mark was invited to join as a second council member, so there have been 2 of us doing that work for 6 months, but then I stepped back because I was having conflicts with the CU South negotiations, and Bob actually has been subbing in for me, so that's where I believe it stands now.
Did you find CU South to be taking up a lot of your time? Okay. It's an interesting committee. It is very multidisciplinary in terms of the representatives who are participating in it. It's a large group, sometimes a little bit unwieldy, but it is attempting to bring suggestions to the council that hopefully we will consider next year of specific actions we might take to deal with some of the problems that we've been experiencing up there. So it's interesting. If you're inclined to do that, I recommend it as an interesting committee to participate on.
Great, thank you. And the next committee on this list we disbanded at the last meeting.
And since there is a little bit of community misunderstanding around this, possibly, if it could be corrected before it's struck through, it was not Sam and I on that subcommittee for the last,
right?
CU South process subcommittee. So if we could insert Aaron and Mark, I think, as the more recent subcommittee members, and then strike it out, I think that would be beneficial.
They took our jobs away.
Yeah. And then Guiding Coalition for Racial Equity. Mary.
Yeah, I'll take that one. That was one that was started when the city joined the GARE, which is the Government Alliance on Racial Equity, of which there's numerous cities that are members. And it has been evolving as our whole approach to racial equity has been evolving as well. And so it's an important committee that meets once a month for about an hour. And I think that the next council will have quite a say in how this moves forward, because it's, like I said, it's been evolving, and it includes members of director members. So in it is Nuria and Maris Harold and Kurt Fernaber and Jen Sprinkle, as well as the council members. So.
And Amy. Can I just add that I resigned from that, like, I don't know, 6 months ago or so, so my name should also be struck there.
Okay, great. And
Nuria looked like she wanted to say something.
Oh, I just didn't hear you say Amy, so.
Oh, and Amy Kane, of course.
Yes.
How could I forget Amy Kane? Oh my God, I'm so sorry, Amy. And of course, Amy Kane.
Great, thank you. And Bob, would you like to talk about the police master plan?
Sure. About 6 or 8 months ago, we started the work on towards a police master plan, and that work will last about another 8 to 12 months. It should be wrapped up towards the end of next year. This is a process subcommittee, so we're not making decisions about what goes in the police master plan, but we're trying to guide staff in engagement with the community so we can receive as much community input on the police master plan. The committee actually consists of 4 people, 2 members of the community who council appointed, and then Junie and I. And Junie, in a hotline post, indicated that she would be happy to step aside in this one. I think I would actually be happy to step aside in this one too, because we're at a real natural breaking point. We've kind of finished the first half of this project. There's no institutional knowledge that people that join would need to go into the second half of this project. It's all about engagement. So while all of these committees are open for new council members to raise their hands, this would be a particularly good one for new council members to raise their hands, because there doesn't require any background, just a sense of how to reach out to the community and hear what they have to say about policing.
Super, and would you like to kick us off on the next one as well? And then we'll go to Rachel.
Rachel, do you want to do community engagement?
I'd love to, because I love doing this committee with Bob Yates. So this committee, and I think like almost the whole engagement committees in this room, I think, right? Committee members. We get together and talk about ways that we can improve how council and community members hear from each other. So it's everything from the email system to whether we want to do more chats with council or, change up different ways that we are offering to be available to the community and open comment. And so the subcommittee hears from staff and hears from the community. We also have community specific events where we invite the community to let us know how they think we can do engagement better. And a recent example would be Bob and I are going to pilot doing office hours together through city staff on like twice a month. So those are the sorts of things that the committee looks at. And I don't know that there's really a rhythm. It's like kind of sometimes we meet monthly. Sometimes it'll be a little more than a month apart. If there's really something urgent that we need to look at, it could be a couple times a month, and the time is very varied. So we'll just do like a doodle poll and see when people are available. Bob, anything to add?
You have some?
Or the next one.
Okay, so the next ones are local board member appointments, and I think this is one that the next council might think about which of these are required, which aren't, and so on. But with that, we'll just go through them, and that'll be for the next council. Boulder Museum of Contemporary Art, Aaron.
Yeah, so this is our beloved local contemporary art museum. You are a full voting member of the board, and it meets quarterly for 2 to 3 hours. So you get all in depth with their financials and the next exhibits they're showing. And so it's a good one for a lover of art and culture.
I've served as council's liaison to the Convention and Visitors Bureau for the entire 6 years I've been on council. The reason why we have a council representative on this one is the Convention and Visitors Bureau receives about $2 million a year in city tax revenues, and they use that money to generate interest in Boulder by visitors from near and far. And one of the things that we have been steering the Convention and Visitors Bureau towards in the last couple of years is really focusing more on what I'll call local visitors, people who actually already live in and near Boulder, and how to create events and attractions that would be of interest to them, and to give grants to local organizations that put on performing arts and other events that people that live here in Boulder. So while it's called the Convention and Visitors Bureau, it's as much about people who live in Boulder and making Boulder continuing to be an interesting place for people who are both visiting for a few days and people who live here.
Great. Thank you, Bob. And Mark, you want to talk to us about the dairy arts?
The dairy is an interesting assignment. I won't say it's a very heavy lift. It used to be one meeting a month, and they're going down to one meeting per quarter. Much easier. And their meetings are at 8:30 in the morning, the day after we have council. So it can be a little painful. But it's a wonderful organization. You have the opportunity also to participate in one of their subcommittees. I'm on their facilities subcommittee just because I have background in some of those issues that they deal with. It's extremely well run. They've weathered COVID very well. And so if you have an interest in the arts, it can be a very interesting assignment to take on.
And would you like to talk about the bid next?
I'll let Bob do the bid, because I'll do BHP.
Sure. I'm going back to Convention Visitors Bureau. That does meet once a month, typically on Thursday afternoons. The Business Improvement District is one that, Sandra, would be helpful to know if we actually have to have two representatives on it, because Mark and I serve on that together. I've been on it for 6 years with various partners, and we struggle sometimes to come up with two people worth of content to report to the Business Improvement District. The Business Improvement District is a legal taxing authority within the city, so it's quasi-governmental, and it up until recently it's met monthly, and Mark and I report to the representatives on that board what's going on from the city perspective, and they do the same thing as to downtown. Starting next year, that meeting will go to quarterly also, which is a lighter lift. But the other thing that would be helpful to know is whether we actually truly have to have two council members on it, because I think that's probably one too many. Don't you agree, Mark? Yeah.
And having been on it, I agree it is. But I will say that having one council member go to these meetings is important. My recollection when I was on it was there's a good exchange with the council members for 10 or 15 minutes, usually at the beginning of the meeting. So having one is important, but I think two might be overkill. And now we're going to move into a couple more and then sister cities. So Boulder Housing Partners.
This one is also a fairly heavy lift. That they are operating under various federal programs for financing their housing projects. One needs to get a little deep into how they do what they do and the programs that they're operating under. They do meet monthly, and probably helps to have some technical background in housing. I wouldn't say essential, just useful. And again, very detail-oriented, somewhat numbers-oriented. They have a wonderful board, and as I said, it does require a bit of time.
Super. And Mary, would you like to talk to us about the Chautauqua?
I can, although Rachel is serving already. Thank you, Rachel. So because the Chautauqua Association leases land from the city, they have city representation there, and they meet roughly about once a month, take maybe a couple months off in the summer, and then also in the winter. But you're there to basically represent the city perspective on any of their activities, any and all of their activities. And I'll add this much, that right now the board is kind of changing. Earlier this year, there was a vote to change the way in which board members are appointed. They will be appointed now versus getting elected. So this, I think, is a good change, which will bring the ability of the board itself to identify where its gaps are in board representation, so that they can be more high functioning. And yeah, so it's an interesting board. If you like Chautauqua, it's great. And the meetings are supposed to be about an hour and a half long, but I did not attend any hour and a half long meetings. They were all about 3. So, but like I said, it's in flux and changing.
Great. And then what we have left is sister cities. So I'll start with the sister city subcommittee, Rachel or Adam.
So yeah, this was not even once a month. I think once every other month, something like that originally. Problem we can't remember is because as soon as COVID hit, we had only had 2 meetings before that, and then it essentially, every country had their own bigger issues to deal with. So we haven't really met, and I'm hoping it will pick back up, but really need someone who's probably interested in helping drive that into continuation, honestly.
It seemed to me that our big job was like planning a dinner, and that we haven't had it in 2 years. So I would look to staff support for leading that effort, because I don't know what we were supposed to do. I don't know what we're doing on that subcommittee. We didn't do it.
So I served on that committee, and where more council involvement comes in is when there's a new sister city that's being proposed, and that's when it sees more action.
And so on sister cities, just a quick heads up for new council members. Those are not official city organizations of any kind. We charter them, and that is all we do with them. And we maintain relations and hear from them when they have requests of us or whatever. We try and appoint 1 council member per sister city, but we have 10 sister cities now, so it's not clear exactly how that's going to evolve. The annual sister city dinner, when it happens, is great because you get to learn what's going on with all these great organizations. But by and large, being on a sister city committee doesn't usually entail much work at all. Maybe 1 meeting a year, maybe 2 has been my experience. And Bob.
One thing I will say about serving as a liaison to one of these sister cities is there's an opportunity to take a really cool trip. Now, the city does not reimburse. This is all out of your own pocket. I've had the opportunity to visit Nablus, Palestine, and Ramat HaNegev, Israel, and on behalf of the sister cities, and you get to meet the mayor and go on tours of soap factories and all sorts of really, really cool things in those towns, but it is out of your own pocket. And there is I'm the representative to Dushanbe, Tajikistan, and there is a trip tentatively planned for this coming fall for Dushanbe. So if anyone wants to go to Dushanbe, they might want to raise their hand for that one.
Great, thank you. So with that, we're done. That is our list of committees, both internal and external. I will say this is the hidden work of council. There's more hidden work of council, but this is a bunch of stuff that you sign up for, and some of it's fun, some of it's less fun, but it is all part of the job description for sure. With that, we are done with this item and done with the agenda. So I think it'd be appropriate time if anyone wants to say a few last things before we gavel the last meeting of this council closed. Rachel, I saw your hand.
I saw Aaron going first.
I'll just be flip. Where are like little tassels and headboards that we can throw into the air for the end of the council?
Asks.
There you go. I'll say a few words at the luncheon on Thursday, but it's been a pleasure.
I haven't done this before, so I'm going to kind of follow Aaron's lead here. I thought maybe we would each say, like I got to say some words about Adam and Bob about Sam. Did we not go around. And
Whatever you want.
what we like about each other. I don't know how it works. Aaron's gonna do. I mean, I'm happy to spare members of the public if that's the routine.
There's no
But if-
routine. This is totally make it up on your own.
Okay, well, I'll just say a couple words then. I'll start with Mirabai, who's been patiently up there on screen all night. Hi, Mirabai. We didn't overlap much, so I'm sorry that we didn't get to know each other better. And I will say that as someone who's also passionate about issues I care about, I very much respect and admire your tenacity in advocating for your values, and appreciated you doing that steadfastly. And I wish you joy in your newfound freedom.
Thanks so much, Rachel. It's really sweet. Appreciate it.
You're welcome. I mean, if this is all new, like, do we all just want to say nice things about Mirabai for a moment, and then it doesn't need to be the Rachel show. Yeah.
I will say that the happiest people I have ever seen are the departing members of City Council. They smile all the time. I've never seen people smile all the time before, but it's been my honor and privilege to serve with all of you. We haven't always agreed on everything, but that doesn't matter. I've been impressed with each one of you. It's simply been a privilege to get to know you to the extent that I have and to work with you. And I'm sorry that all of you are leaving. You're going on to better things, I guess. And keep smiling.
Bob.
Like Aaron, I'll save most of my comments for our luncheon next Tuesday, but I do want to, this is the third council that Aaron and I have each served on, third two-year council, and with all due respect to our prior colleagues, I would say it's my favorite council. And that's caused by a couple of things. Number one, the relationship that we've built. Maybe it was a relationship of fire because of COVID, or maybe it's just because you're all really super nice people. And I think that Sam deserves a lot of credit for bringing us together and keeping us together. And my hope for the next council and for our colleagues that are going to join us starting next week is that council is at least as good as this one, because this has been a really, really good group of people to serve with. So thank you all.
Can I just say, Bob, you're going to get angry emails now from like Andrew Shoemaker and Zan Jones. Be like, well, what the heck? Am I chopped liver?
Well, the answer, of course, is yes.
Can I double dip? Because I was starting with Mirabai, but I did have words for each of you, and
Please do.
I'm freestyling here. Just say a little bit more about Adam. Part of my campaign slogan or logo was a rainbow, and I sort of have come to see you as like the rainbow bearer and the sort of bringer of just good things, and sort of a moral center to this council. So you will be deeply missed, and I thank you for being that for us. And that means no disrespect to the rest of you.
Thanks, Rachel.
You're welcome. And then for Mary, it has been a joy to me over the last year that we have gotten a little closer, and I have considered you a mentor and a friend, and that was just like a big bonus for me, because I think I started out as an activist, and you sort of have impressions of people from the other side of the dais, and I'm grateful that you were so generous with your time and mentoring of me. So thank you for that. And Sam, I want to echo some sentiments that other people have shared tonight, how well you stepped into the mayor role, and especially from my vantage point after the King Soopers shooting really just got all of us in the whole community off our dot. You were the center of the community, and I don't think anybody could have done better in the aftermath of that than you did. So I appreciate all that you did, holding the community together. And then, kind of walked through the fire on CU South negotiations, and admired your leadership and courage there. So thank you for a job really well done.
I want to jump in and just say thank you to everyone on this council. This is my fourth council, and they're all different. And I think this is the council that far and away had the heaviest lift of anyone. And it's hard to describe to people who haven't been on council before, but all of the things that you think are critically important, like land use and homelessness and police reform, all of those things are incredibly important. But when a pandemic lands, all of a sudden this gets elevated to the very top of the list, and nobody has a script. So nobody on this council knew what to do exactly, and we all had to come together and figure it out, which meant that we all had to hear from each other because nobody had the right answer. The right answers came from the entire community, but we had to help distill them with our staff and with the county staff and so on. So, you know, thank you to you all for the personal sacrifices that I know that you made to be able to bring the community through this tough couple of years that we've had. We had some 5-4 votes. Not everything that happened on this council was easy. And what I think is great is we had 5-4 votes, and then we came back together to deal with all the other things that we had to deal with. So I think it's been an exceptional council from that standpoint, the challenges it had to face. And, you know, staff also had to face all of those challenges. And if it weren't for the staff, we couldn't have done our jobs at all. And so it's just something, you know, that we can all carry with us forward, that we were part of this and that we had to adapt and overcome. And I think this council did that and managed to keep really good interpersonal relationships throughout that. And I hope that the next council takes that, as Bob said, and thinks about, you know, there will be disagreements. I predict there will be a 5-4 vote sometime on the next council. And when that 5-4 vote happens, go home, get some sleep, and realize it was a disagreement. But it was not a civil war and isn't the cause for ongoing disputation. So I guess I'll just say thank you to everyone. I'm proud of the work this council did. And I know it took a lot out of everyone, so it's much appreciated.
So I just want to say one short thing. Rachel, last week you asked me what I was going to miss the most, and I've thought about it since then. And I think what I'm going to miss the most is having colleagues, and having colleagues, especially in this council, under the pressure cooker that it was actually quite a gift. And so thank you all. That's what I'll miss.
All right. Anything else? With that, gavel is closed at 9:36.